Good morning. Let me take this opportunity to welcome everybody present to the committee meeting after the Good Friday holidays. I hope everybody had a blessed Easter weekend. I hope we are all refreshed members and energized to take our work in this committee forward. Firstly, let me welcome the Minister of the DPSA, Honourable Nkosi Buthelezi, and also Deputy Minister Honourable Kekana for your presence here. Thank you very much for attending. We welcome all members of being here at this crucial meeting and all support staff and maybe members of the media that might be here as well. With that, all protocol observed. Thank you very much for everybody and good morning. Apologies. We will first deal with the apologies. I've received apologies from Honourable Pulwane and Honourable Letlape, and we have noted those apologies. If there are any other apologies, you are welcome to note that as well. None received. Wonderful. Members, we have a big day ahead of us, lots of agenda items. We are scheduled to go all the way up to 4:30 this afternoon. We will break for lunch between 1 o'clock and 2 o'clock, and we will work as effectively as possible to make sure that all content is worked through and that all members have a good opportunity to deliberate and engage with the presentations, the important presentations which we received today. Members, during the State of the Nation address, the President has reiterated his commitment to the 7th Government of National Unity by announcing 3 government priorities, which include building a capable, ethical and developmental state, as well as strengthening the role of the PSC, the Public Service Commission. This was followed by the budget speech where the Minister of Finance allocated budgets to various government departments to achieve some of these priorities. The Minister of Planning, Monitoring and Evaluation also published the Medium-Term Development Plan 25 to 29, which provides details of government priorities. Followed by departments aligning their activities with the MTDP and budget allocation through tabling of strategic plans to Parliament. So the purpose of today's meeting is to afford the departments and entities under the Ministry an opportunity to outline their 5-year plans and as well as their annual plan. The committee will make inputs towards the journey of the 5-year and ensure robust oversight throughout. But with those few words, let me introduce the Minister and Deputy Minister to just provide some opening remarks before we move on to the presenters. Minister, over to you. Thank you.
Yeah, thank you very much, Honourable Chair, and greetings to the members of the committee. Firstly, Chair, I want to appreciate the innovation on the part of your committee to provide us members with this, because it helps to attach names to the faces. So sometimes we take it for granted that we know each other, so it makes things easy. Even when the department is responding, they know exactly who do they respond to. Greetings to your good self and all members of the committee, the collective leadership from the department and all its entities. Firstly, Chair, I want to thank you very much for this opportunity, and it's always a pleasure and honor to appear before your committee. Today, Chair, we are presenting the strategic plan for the period 2025 to 2030 and the annual performance plan for the financial year 2025-26 for the Department of Public Service Administration, DPSA, and its entities, which are the National School of Government, the Center for Public Innovation, the Government Employee Medical Scheme, and the Public Service Commission. Before I proceed, Chair, kindly allow me to express my sincere appreciation for the continued guidance and oversight that the Portfolio Committee provides in strengthening our collective mission of building a professional, ethical and capable public service, as well as its continued oversight and support in guiding the sector through the path of reform and innovation. Honorable Chair, with your indulgence, I would like to humbly request that I be permitted to present the plans for all these institutions as in a consultative manner. Of course, I'm sorry, with the TM here, with whom we are going to lead this process. This request, Honorable Chairperson, arises from the current state of my health, which is known to everybody, I believe, and I may not be able to stay for the rest of the day because I only take as much as my body allows. So it is in the interest of managing time effectively and ensuring that I provide the committee with a coherent and comprehensive overview of our strategic direction as a department. I also greet the leaders of entities. I forgot to do that. With your kind permission, therefore, Chair, I will now proceed to the substance of the plans as prepared. Today's engagement is indeed a reflection of our collective commitment to building a capable, professional and ethical public service that delivers for the people of this country. It's where we reflect on the strategic trajectory of these institutions that form the engine room of our public administration. As we chart the course for the 2025-2030 planning cycle, we do so as the imperative of the third priority of the seventh administration, which is to build a capable, ethical and development state, as we have alluded to. More so, a state that delivers, innovates and earns the trust of its citizens. We are joined also by the leadership of the 4 institutions under the Public Service and Administration portfolio, each distinct in their mandate, yet united in purpose to making government work better for the people of South Africa. I will therefore begin with the Department of Public Service and Administration. The department is focused on returning to the fundamentals of what it means to serve with integrity, competence and discipline. Hence, it has tabled a strategic plan and annual performance plan grounded in the vision of professionalized public administration and inspired by the 7th administration, which is the government of national unity. The strategic plan and the APP commits to strengthening human resource practice, fighting corruption, improving labor relations, and embedding a culture of accountability. But we must go beyond compliance, Honorable Chair and Honorable Members. We need a value-driven service where every official understands that serving the public is a calling. Through the implementation of the national framework towards the professionalization of public sector, DPSA will strengthen human resource development, labor relations and integrity framework. This work is crucial as we drive reforms that embeds ethical leadership, enforce accountability, and ensure that public service becomes a true career of choice. We are also aware of the uneven implementation of policies across departments and provinces. There is a need for a tighter coordination, clearer accountability lines, and consequence management that is not on paper but in practice. On the Center for Public Service Innovation, as we face an era of disruption and rapid change, the CPSI's strategic plan position it as a catalyst for problem solving within the state. The CPSI is stepping into a more strategic role of not just piloting ideas, but helping the entire public sector to think and do differently. It is championing for homegrown innovations, not as a buzzword, but as a tool to solve problems that communities face every day, from long queues at clinics to slow housing approval. CPSI is doing so by ensuring that technology and creativity are harnessed in serving fellow citizens. Importantly, it expands its role in coordinating the public sector innovation ecosystem more importantly rather, its expanded role in coordinating the public sector innovation ecosystem will help institutionalize innovation across all spheres of government. However, innovation cannot thrive in silos or without resources. We must address the capacity constraints that hold CPSI back from scaling good ideas across departments and municipalities. Honorable Chair and members, professionalization may begin with training, but the truth is, it doesn't end there. The National School of Government continues to reposition itself as the high-impact learning institution aligned to the future needs of the state, and it's being repositioned as a real driver of culture change in the public sector. It focuses on mandatory training, leadership development, and building a common ethos in the public sector. And that is key to embedding a culture of continuous learning and improvement. The school is rolling out mandatory courses, building leadership pipelines, and instilling the ethos of Batubile. But the question we must all ask ourselves is whether we are reaching the front line where change is most needed. We therefore need to strengthen monitoring of training outcomes and ensuring that learning leads to visible change in how officials interact with the public, since professionalization cannot succeed without a deliberate and a well-resourced approach to learning and development. Honorable Chairperson, towards my conclusion, we need also to be mindful of the fact that we are only as strong as the people we lead. Hence, GEMS plays a crucial role in supporting the well-being of public servants. The scheme is making strides in financial sustainability and improved access to care. However, affordability for lower-income workers remains a bit of a challenge. We must therefore ensure that no public servant is excluded from essential health services due to cost. GEMS also has an important role to play in prevention and wellness as the health and well-being of our public servants directly affects their ability to serve with excellence. As a key stakeholder, GEMS in this regard is undertaking strategic initiatives to improve access to quality healthcare while ensuring financial sustainability. The scheme focuses on wellness, efficiency, and inclusion, especially for lower-income employees, speaks to our broader goal of creating an enabling environment for a productive public servant. I will finally conclude with our moral compass and the constitutional body that speaks truth to power, which is the PSC. The PSC remains constitutional guardian of integrity, fairness, and merit within the public service. Its strategic plan and APP are evidence of a body that is responsible to government priorities and poised to assume its expanded mandate as envisaged in the PSC bill. Notwithstanding its resource constraints, the PSC continues to safeguard public administration from undue influence and to serve as a trusted institution that upholds the principles of accountability, good governance. Its planning speaks to a strong commitment to integrity, fairness, even in a context of limited resources. We are grateful, therefore, Chairperson and the portfolio committees, for your strong support of the PSC bill, which will allow the Commission to extend its mandate more effectively to all spheres of government. But let me be frank, Chair, and say that the PSC must be adequately funded if we are serious about building an ethical state, because independence without capacity is just independence only in name. Honorable Chair and members, we are grateful for the committee's consistent support in strengthening these institutions. Their collective work is not only technical or administrative, but profoundly constitutional. It speaks to the kind of state we are becoming, one that is responsive, people-centered, and built on foundations of ethical and empowered public servants. Nonetheless, Chair, having presented on these institutions, on the theme that comes through my mind is that we need to go back to basics, to serve our fellow citizens with humility, to respond on time, to speak with respect, and to treat state resources as sacred. These are not just abstract values, but are everyday practice that shapes the experience of government. While doing so, we also need to be honest about the gaps, such as that too many public servants see their work as just a job, not a duty, and that we're not doing enough to reward excellence or to weed out underperformance. If we are to build state capacity, we must start by rebuilding our culture in the public service. In conclusion, our duty in the 7th administration is to deliver results, and our task is not only to plan, but to lead. And leadership means rolling up our sleeves, taking responsibility, and modeling the kind of service we expect from others. I thank you so much, Honorable Chairperson.
Thank you very much, Minister, for those kind words. Deputy Minister, would you like to make some opening remarks as well?
No, thank you, Honorable Chair.
Thank you very much. Members, with those remarks by the Minister, which are definitely welcomed, we can now move on to the rest of the agenda. Members, as per our usual, we will move from the start and have all four presentations done and have deliberations at the end to make the work of the committee as efficient as possible. So please make notes of all the questions that you would like to pose or comments you would like to make at the end of the presentation, and we will move through all four before we give an opportunity for members to deliberate. Thank you very much. With that, we can move on to agenda item number 3, the
Chair.
briefing by the National School of Government. Honourable, sorry, apologies, Honourable.
Thank you, Chair.
Yes.
Let me greet the Honorable Minister, Deputy Minister, and all protocol observed due to the time. Just a humble proposal, Chairperson, because if we will be dealing with the entire presentation, then that will be the entire Holy Bible. Maybe just a humble proposal that maybe let's take 2, then we engage, then we take another 2. Thank you.
Members, we've got a proposal that we break the 4 presentations into 2 deliberations and do another 2. I don't have a problem with that. That is how the agenda was set out. But Honourable Member, I think it was you in our previous session who said that you preferred that we actually do all 4 presentations first and do one deliberation session at the end. So that's kind of why I did it that way. But I'm happy to do it both ways. Is there any member that's opposed to the suggestion? Honourable Kaba, please proceed.
Thank you very much, Chair. Greeting to the Minister and the Deputy Minister. All protocol is observed. Chair, I second the proposal from the Honourable Member. Thank you.
Okay, seems like we've got no objections. That's 100% with me. We can do follow the agenda then exactly like it's set out, do the first 2, the NSG and the GEMS presentations, and then do deliberations. Members, if there are no more comments, we can then move on to the presentation from the National School of Government. Please proceed. Thank you.
Thank you, Honorable Chair. Good morning to you, Minister, Deputy Minister, and all the honorable members and the colleagues from the MPSA portfolio, as we call it, Honorable Chair, because it's a vast portfolio, although when people make reference to it, because of the name, it's get narrowed to DPSA at the level of the minister. It's a ministry for Public Administration, where the minister is an EA to these 5 institutions that will be presenting today, starting with the 4 this morning. We are, as the National School of Government, an execution arm of HRD and institutional building support that the minister has spoken about. Of course, you know, he referred to the PSC as being our guardians for Chapter 10. DPSA is a policy department, the regulator, and GEMS, of course, dealing with health and wellness issues, and CPSI dealing with innovation, and we need to be seen in that context. In this presentation, on the strategic, you know, plan, of course, we looking at where we are now. What is important, as they say, a strategy is basically a map of the path between where you are and where you want to be, which is your destiny. And so we will begin by just sharing where we are today as the school, which is an important determinant for where we want to be in the next in the next 5 years. And of course, it's important that we demonstrate that there's a strong foundation that has been built upon which we can build over the next 5 years. And of course, in the subsequent years, when we appear before the committee during these intervals, we will be outlining the APPs, which is the annual pit stops, in a sense, demonstrating where we are today and where we wish to be. With regards to the past 5 years, Honorable Chair and members, this is a very high-level summary. And again, we're presenting it because it's important to test whether or not there is a strong foundation for us to achieve what we want to achieve. What we have seen as a school over the past 5 years is that we have built a robust institution. We have introduced new programs. For an example, where we are training senior and executive leadership in all 3 spheres of government. We are doing work in the legislative sector. We are doing work in the SOEs. We are doing a very successful induction program in the SOEs, and hopefully it will be compulsory very soon, as recommended in the framework that the Honourable Minister has referred to. We've introduced compulsory programs such as Nugela, and there is almost 99% compliance with that program. No single senior manager has been appointed without completing Nugela, which is a very good. DPSA is monitoring that, and of course, there are many other mechanisms that have been put in place, which is good as we build progressively towards a government-wide examination. Of course, on the professionalization front, as the minister has indicated, we've got a framework which is being fully implemented, and as the minister highlighted, before this committee have gone through 3 pieces of legislation, which is now moving to the NCOP, and those 3 pieces of legislation are vital for the operationalization of the framework. We've got a very viable youth program underway. We have a program of training traditional leaders. It's one of our fastest growing and strong program that we are doing, and we thank the support of all the institutions of governing the traditional leadership in the country. We've got gender mainstreaming interventions that were not there before, but importantly, as an institution providing training and development support, we also have to enhance our quality management system and professionalize those who stand before our learners. Our curriculum is being peer reviewed. We do a lot of co-creation programs. So when we design a program that we have no capacity to do, as we've just recently done a course on how to manage disasters, we have had to get experts and work with the departments responsible to co-create a program. That means that there is no program we cannot design and deliver if we work in cooperation with others, which is one of the strengths that we have gained over the past 5 years. And importantly, Chair, I must assure, I invited a few of them today, that as an institution ourselves, we have made sure that we build a strong organization, that we must be efficient, we must be accountable, and that we must also be innovative as an institution. And they have assembled a team of very ambitious officials who are competent and professional and they're not scared of taking on any task, as we've seen in their engagement to help GNU and other coalition governments to stabilize. We are financially stable, which is important as an institution. We are growing in that regard. In fact, Chair, we have received a letter sent by Minister of Finance to our minister saying that some of the surplus that we generated in the previous financial year, we can keep that to invest in digital transformation of our organization, and it is because we are trusted by those that we work with. And finally, we have built a strong brand. This is just a highlight of what has been done, the number of officials who've come through our gates, and I will come to what the minister has challenged us to do just now. But this is it's showing the type of work we have done. Honorable Chair, COVID was a big challenge for the NSG 5 years ago. At that time, over 95% of our work was delivered face-to-face. With the COVID pandemic, it means we're losing numbers in terms of people who could be trained, and we're losing revenue. We're losing over 10 million rands a month that we couldn't invoice and settle because of COVID. And with the work that we have had to adjust over the years, you can see the numbers now that we have moved into open distance learning, which means that an official of the state can do a course at the NSG wherever they are, and that has helped us to be more sustainable, to be more accessible and agile, whilst we still retain a core of the programs that are delivered face-to-face. And importantly, we were entrusted by the minister to lead the work of designing the professionalization framework, working with our counterparts in the MPSA portfolio. This was successfully done, adopted, and it is being implemented. It has been adopted by SALGA. The work we are doing with SALGA is how to operationalize a local government level. And of course, there was a big change in our mandate through you, Chair. When you began, you quoted the 3 priorities, and we'll refer to it as to how we have had to align our strategy over the next 5 years with the strategic priorities of government, because as an organ of state, we are obliged to do so. And as I have said, we built honest, stable leadership, ethical. That's what our leadership expect from us. Effective corporate governance over a decade of clean audit, during that period, and financial viability. And we've built a brand that is trusted. And that is why, Chair and honorable members, as an NSG, we're training government officials and leaders, including in cabinet level, in countries like Kenya. We are going to Ghana very soon, where we've done work in Zambia, we've done work in the DRC, we've done work in Cote d'Ivoire, and several others. And that's because we've built a brand that is trusted by people, not because it looks nice, but because of the content of that brand. And these are some of the highlights. We have recognized that we will not be able to change the culture and the mindset of officials only if we bring them into class, either virtual, online, or face-to-face. And that is why we've also introduced a series of thought leadership conversations where we can bring perspectives onto the people who are in the public in the public sector, to rethink their own practices, to rethink their ways of serving the people. And this is just an example. Of course, in recent times, we're introducing a lot more programs that are responsive, including courses on AI. We've got a course on disaster management. We've got a course on scenario planning. We've got a course on innovation. And there's several other similar initiatives that we'll be introducing. The idea being, whether we're a member of parliament or we're a junior official in the government department or we're a board member, there must be a product that you can get from the National School of Government which responds to your need. And that is how we have reshaped our work. Of course, as I said, we work with our partners in the continent. We are, Chair, the fastest growing school of government in Africa. We clear about it. We are the fastest growing school of government in Africa. But for us to be able to grow as fast as we are is because of these partnerships that we have with other schools of government. So for an example, to strengthen our quality management system, we have had to learn from our colleagues in Ghana in an institution called GIMPA, because they are 50 years older than us. And through our interaction with them, we are gaining a lot. Kenya, It's the same Zambia and several others. And that is how we have built the foundation to prepare us for the next phase. Of course, if I could round up, it's important to then map this journey over these years. Historically, the NSG or its predecessors, Palama, SAMDI, and PSI, we were just supplying education and training products, mainly to public administration. We've shifted over the past 7 years or so to do more demand-driven education and training interventions with a greater focus on needs analysis. So what the needs are, what the gaps are, and how we can respond. And where we are now and into the future, we are growing in a more collaborative approach because, for example, working with some committees in Parliament, we've designed programs that were training members of certain committees in response to the gaps that have been seen in those in those committees. Working with some of the people in the private sector who are interacting with us, we've had to design a course on helping those who work in public affairs on how to interact and work with the public institutions, and we use the MOUs in a very innovative way, and we have to be agile. So, in summary, Honourable Chair, we've built a strong foundation that helps us to prepare for the challenges ahead. As I said when I was making reference to numbers, the Minister has asked that we must change the metric of measuring our performance, that we must move beyond the numbers of how much we have made and how many people we have trained. The Minister is asking a question that says over the next 5 years, we must answer a question that says, when members of the public are interacting with an official who has been trained by the NSG, will they feel it different? Will they feel that they were treated differently by this official, because the official has been trained by the NSG as opposed to any other? This is a challenge that we are taking on. It means our own approach to designing curriculum, to providing training to people has to change, because that is a much bigger, I would say, revolutionary way of measuring performance, whereas in many instances we are just measuring using numbers as a metric, and that is part of the weight then, or I'll say something new that has to preoccupy the leadership of the NSG as we design programs into the future. Of course, as I said, we have been able to retain some resources from Treasury, from the surpluses we have generated, and so there's a big intervention underway to digitally transform the institution so that people can learn wherever they are in a most interactive way. And as I move to my colleague, Dino, we have looked at the MTDP, Honourable Chair, and what it means for us in terms of all these priorities. We believe that whilst we are on priority number 3, which is where we belong as our core business, but the work that we do has got catalytic effect on others as well. By that I mean, when we are convening an economic governance school, engaging with members of the executive or other politicians, we work with them in a manner that helps them answer the question, how are the decisions that you are making, either as a committee or as a cabinet or any other structure, helping to support these priorities of the state. But by doing that, people can invest better, can make better decisions about how they resource and govern their institution. And so we are firmly aligned with the MTDP. We've been supporting the work of the GNU. We've been invested in many departments. Over 32 departments and SOEs have gone through our hands since the government was formed after the elections last year, where we were working them either to align and sort out their mandate issues, because some of them there was no clarity on mandate, or there was a misalignment, or helping them to do change management in many instances. Change requires that it must be managed because there are disruptions, and in some instances we were just purely helping them to do a new strategic plan that is aligned to the MTDP. And on the basis of that, we think that many institutions have actually made the transition, and they are ready to diligently execute the mandate of the government of the day. With your permission, Chair, I will like my colleague Dino, who's the head of strategy, to take us through the new vision and then the rest of the presentation. Thank you.
Thank you, Chair. Good morning to the Chair, to the honourable members, our Minister and Deputy Minister, and to the colleagues. Thank you, Principal, for that. I think, Chair, what is important is that we've really used this opportunity to contextualize the last 5 years with where we want to go for the next 5 years. And in our own planning session, we took conscious decisions that we needed to build from the last 5 years. Therefore, what was important for us, Chair, was to not move too far away from the vision and mission that we had maintained over the last 5 years. Our new vision is very simply a capable and ethical public sector, and I think that's what we are all driving towards. Importantly for us, though, in the mission statement and aligning to the MTDP, is about cultivating professional public sector capacity through education, training and development that advances inclusive economic and social growth to the benefit of the people. Now, Chair, in the issues that we have raised, importantly is in the work that we will be doing for the next 5 years, so we are going to structure the work through a structured learning pathway, a curriculum architecture that will be built on 5 broad areas, which really is around skills programs, the professional programs, bespoke programs, academic qualifications, and occupational qualifications. Chair, I must indicate it's a very exciting time for us because for the first time we will start introducing full qualifications as the National School of Government. Whilst we're doing some work currently in partnership, this will give us the ability over the next 5 years to deliver as the National School of as the School of Government a full qualification. Also interesting, Chair, is this in this diagram we've been doing a lot of the deliveries face-to-face, the open distance e-learning. We are going to be introducing a lot more around micro-learning and the customized, the just-in-time interventions. But importantly, Chair, as with the digital transformation, we want to introduce more immersive learning, and we want to bring the issues of virtual realities to public servants in the classroom. And we are quite excited that over the next 5 years we'll be building that capacity within the NSG. Now, in further alignment, Chair, with the MTDP, we had to look at what are some of the key result areas that the departments have to focus on. And so at a very high level, Chair, we've just summarized some of the interventions that we'll be focusing on. So, for example, under priority 1 on the issue of inclusive growth and job creation, we want to focus on interventions that will support sustainable economic development and diplomacy, the infrastructure planning, finance and procurement, and of course, importantly, the DDM support through integrated planning and coordination, and more work that has to be done at local government level when it comes to issues of municipal finance and governance. Our focus around strategic priority 2 will focus a lot around the Women in Leadership program that we have launched, as well as youth development. And then on building the capable state is, it's a lot around promoting values-based and ethical leadership. Importantly, we've through the work that we've been doing with many of the institutions, we understand that smart governance and digital-driven transformation is important, but also how do we build and sustain resilient public institutions? We think that is important as part of the learning that we have to undertake. I think the Principal has explained the work on the framework. We think it's important areas of work for us. We've already started partnering with professional bodies. There's more work that we have to do with the professional bodies, but importantly as well, the work that we have to undertake in Nukela, which is around reviewing the current Nukela program that now splits into the 2 levels, as well as the introduction of Nukela to the middle management service as well. Now, Chair, on the issue of digital interventions, we were quite pleased that we've signed a partnership with Microsoft as well as NEMISA. The President announced this at the AI Skills Initiative, and so the 3 of us, Microsoft, NEMISA, and the National School of Government, will be working around programs that will build AI skills amongst the public servants. We've got a partnership with Centec as well. What we have not reflected here, Chair, is the work that we are currently undertaking with Amazon Web Services, and we hope that within this financial year we'll be able to enter into a partnership with them as well that will further strengthen the work around digital transformation in the public service. Now, at a very high level, Chair, we thought we should indicate what the priorities are for the 25-26 financial year. Much as we've been guided, by the Minister in terms of, looking at the impact and outcomes of our training programs. We will track the training numbers, and our target for this year is around 54,520 learners. Our revenue generation target in the region of 103 million. What we hope to start with is, with the introduction of the learning pathways curriculum framework, the postgraduate, qualification, but we're also going to be introducing, as the National School of Government, a micro-credentials framework. We are looking at new business opportunities, new market opportunities, guided both by our Deputy Minister and Deputy Minister and the Minister, We want to focus more in local government and the SOE space, in as far as finding new opportunities, the ICT solutions that we will be looking at, and of course, the work that will continue on the brand management and marketing. Chair, we thought we should also share with the committee what is the organizational structure and the two, the two colors rather within the structure. The one in red, really is the voter count of the National School of Government, and the green blocks are, the core business, the trade of the National School of Government. As you will see, Chair, there are 3 branches, within the NSG that report to the principal as well as the CFO, and these are the various, chief directors and directors, within the NSG. We thought importantly, Chair, to also just highlight that, the split in terms of the posts, we have a total of 239 approved posts on our structure, and about 36% of that is within the vote, and 64 on the trade side, and that's where the core business takes place, Chair. Now, on the finance side, we thought on the vote and the trade, this is our current allocation for the 25-26 year, Chair. That's a total of 228 million. Of course, from that amount, there's a transfer that takes place of 112 million, to the trade, and this is the budget that we have allocated for the trade account, with the revenue generation, projection of 103 million. There, Chair. Chair, what we thought we should do as an annexure, in the interest of time, is to share what are some of the targets and indicators for the next 5 years, and this is what we've set out in the 5-year strat plan, and then of course our for the APP there are our targets for program 1 and 2. Importantly, Chair, is that with the new strategy, we'll now be introducing a new service delivery plan. We have 6 IT projects on program 1 that we'll be focusing on as an example. And on program 2, our focus around, the skills assessments, the impact evaluations that we'll be focusing on. And of course, what I've mentioned, the postgraduate qualification and the micro-credentials framework. We will continue the work on the professionalization, importantly around the advocacy sessions, as well as, the new Kerala programs that we will be introducing. And lastly, of course, Chair, the issues of our accreditation processes. We continue to remain as an accredited training provider. It means that we have to maintain, the standards and requirements set by the accrediting bodies. And then, of course, our programs, both when it comes to compulsory programs as well as the open distance e-learning programs, thought leadership, seminars that we have planned, as well as, the induction of boards, members of state-owned entities. Thank you very much, Chair.
Thank you very much. Does that conclude the presentation by the NSG? Thank you so much. We then move on to the briefing by GEMS, the Government Employees Medical Scheme. And thank you very much. I believe this is your first presentation to our committee.
Yeah, thank you, Honourable Chairperson, Mr. De Villiers, and members of the Portfolio Committee on Public Service and Administration. My name is Dr. Nomza Mututu. I'm the chairperson of the Government Medical Scheme, GEMS, Employees Medical Scheme. I'm accompanied by the fellow board member, Mr. Alvin Rapia, who is also a trustee in the board, and the GEMS executive that are led by Dr. Stanley Mulwabi, who's going to be doing the presentation. I'd like to greet Honourable Minister, Mr. Mzamo Buthelezi, and the Deputy Minister, Ms. Pinky Kekana, as well as the Department of Public Service and Administration, led by Mr. Willie Vikela. We are pleased to appear before you today, Honourable Chair, to provide insights into our strategic direction and support for the Department of Public Service and Administration. As a medical aid scheme registered under the Medical Schemes Act, GEMS is committed to providing quality healthcare coverage to public service employees, and our board oversees strategy implementation, ensuring efficient and effective delivery of services. Today we will share the progress and outline key objectives and highlight initiatives aimed at improving healthcare outcomes for our members. We look forward to engaging with you and addressing your questions accordingly. Thank you very much, and over to you, Dr. Stan.
Thank you, Dr. Tutu, and good morning to Chairperson of the Portfolio Committee. The Chairperson has already greeted, so I'll go ahead, just get into the presentation. Our presentation basically was designed in line with the invitation that we received, that we should just come and give a brief on the strategic plan 2025-2030 and how we align with DPSA APP for the 2025-2026 financial year. But we thought as an implementing arm within the DPSA, we should just give a brief background of why GEMS was established. GEMS is actually 20 years old this year, so it's 2 decades that GEMS has been in operation. And it was established on the 1st of January 2005 to basically give access to a public service employee in line with what the Constitution says, that healthcare is a basic human right. The establishment of GEMS was as a result of Cabinet realizing that many government employees could not afford medical cover, particularly those who were on the lower earning brackets. And as a result, the intention was that GEMS should be introduced to redress the past imbalances and cover a section of those public service employees who were previously excluded from having access to healthcare. And over the years, we have traveled a strategic journey that was basically informed by the public sector having to deliver on 3 obligations, which is mainly that it had to provide for retirement benefits, housing benefits, and as GEMS medical benefits. So GEMS was established as a single restricted membership medical scheme, which is regulated in terms of the Medical Schemes Act 131 of 1998. So in terms of what we are required to present to the Portfolio Committee, we derive that from the fact that in terms of the Public Service Act of 1994, as amended, the Minister for Public Service and Administration is responsible for establishing norms and standards relating to, amongst others, health and wellness of employees. And the GEMS mandate, therefore, is aligned with this in that it was to ensure that there is adequate provisioning of healthcare coverage to public service employees that is efficient, cost-effective, equitable, and to provide further options for those who wish to purchase more extensive cover. And that simply means that instead of a medical scheme having only one option that you can join, at GEMS we have 5 options plus 1 sub-option, so 6 choices in all, depending on what you can afford and what your healthcare needs are. So how do we align with the objectives of the the DPSA strategy? The alignment of what we do at GEMS is really aligned to Program 3 of the DPSA, which is basically to improve the health and welfare of public servants in order to create an enabling environment for productivity. And there's quite a few activities that are under this program 3, mainly being that the intention is to improve the health and wealth of public servants as a critical enabler to productivity, to morale, and to service excellence. And also with a view to ensuring that the public service is an employer of choice. And this we can achieve by provision of access to healthcare services. And this is really what GEMS does in supporting the ministry. And also as part of the government's macro benefits that I've mentioned earlier on, in executing our mandate, we fulfill program 3 of the objectives as one of the 3 macro benefits of public service employees. And we are an implementing arm in that we operationalize this objective by ensuring that we provide affordable, accessible, comprehensive medical cover to the government employee. And this is for both physical and mental wellness. And this is very important in ensuring that the 3 goals that are set by the public service, which is to ensure that there is labor peace, there's productivity, and there are fair conditions of service. This can only be achieved when the employees have access to healthcare, and as a result also become a more secure workforce. So we also, as part of our wellness, it's not only about the curative side where a person has to fall sick and then only then do they access healthcare. We also have a proactive health and wellness management, which basically, while those that already have illnesses, we have disease management programs, we have support programs like for mental health, and then we also have preventative care, which is part of the work that we do in partnership with the DPSA as the various pay points. Just some bit of details on some of the disease management programs. We've taken just some of the top priority conditions that are prevalent within the public service employees. One thing that is unique about the government employees medical scheme is that it is the only medical scheme that has got a footprint all over the country, because it's a public service employee everywhere. And as a result, we usually say that GEMS is a microcosm of the society. So what you generally see within the GEMS environment usually is what actually happens in the broader society. And the top 5 conditions that we really have as a priority, and we have disease management programs for hypertension, hyperlipidemia or hypercholesterolemia. We have diabetes, both type 1 and type 2, HIV and mental health diseases. And we have various disease management programs which are designed to improve the quality of life, because we work with the healthcare providers to reduce hospital admissions by ensuring that there's coordination of care of these members, and also to ensure that the members who are on these programs, they adhere to their treatment regimen, and also to come up with programs where we encourage lifestyle changes, because some of these diseases are diseases of lifestyle, and also to prevent the sequelae or the complications that can arise. Those are the top 5, but there are also others that we have listed. We have more than the 5, but the 5 that we have listed there are the top 5, and then the rest we have various that are also part of our disease management program. Then in terms of health and wellness programs, which is basically primary health care, which is aimed more at screening and preventing disease, we have health and wellness screening services, which focuses on preventative measures, ensuring that we go to the various pay points and provide health screening for public service employees so that we can achieve early detection of illness. And if you find that a person was not, because a lot of these illnesses are silent, what we normally refer to as silent diseases, and they become silent killers as a result. So employees of government, when we set up this health and wellness screening events, they have the opportunity to screen for illnesses that they may not be aware of. And once these are detected, then they are encouraged to go and seek help with the healthcare providers, the various healthcare providers. And we do provide support to ensure that they access the correct healthcare professional. And then also, as part of this health and wellness programs, we raise awareness about the importance of lifestyle changes and healthy living. And some of the screening tests that are done at our health and wellness screening programs are listed there on there. I do not have to go through that. So I just also, we thought we should just share some supplementary information regarding how GEMS creates access to health for the public service, and also just about the policy changes that are underway. So our strategic thrust at GEMS is to be a strategic partner towards the realization of universal healthcare coverage. As we all know that there's a lot of policy change that is underway with the National Health Insurance Act having been signed into law last year. So as a implementer of the program that we spoke about, GEMS was started in 2005 and grew to become a scheme that covers 2.4 million beneficiaries at the moment. So 1 in every 4 medical scheme member in the country is covered by the government employees medical scheme. I did mention earlier that there are 5 options and 1 sub-options, but there are 2 that we call flagship options. And the reason for this is that these 2 options we have modeled to be what we say are can be reference options for how primary health care should be delivered in the future, taking into consideration the challenges that are there with affordability that the Minister mentioned earlier on, because one of the biggest challenges has always been the issue of affordability of medical scheme. So through these flagship options, Tanzanite 1 and Emerald, we have established what we call health provider networks, where we agree with the healthcare providers, the doctors, the pharmacists, the dentists, specialists, that they become part of a provider network, and they have to agree what they charge our members when our members consult with them. And the various networks have come to grow to become among the biggest healthcare provider networks in the countries, with the GPs, 8,000 general practitioners belonging to the GEMS networks, and so and so. But what is important is how much do we cover? How much of the GEMS members do we cover? And the geo coverage shows that our coverage is more than adequate. With GPs, is 96% of those that stay within a certain radius next to a GP. So our coverage of networks is very good, which enables us to have our members access healthcare with these healthcare providers, where there are agreements between the GEMS and the healthcare providers, what they should charge. This is very important because members are faced with co-pays when they consult, and that is one of the biggest challenges that we are trying to solve. And over the years, GEMS has been reducing the co-pays to the extent that we have reached that less than 4% of our members are faced with co-pays when they go and see our network providers. And then some of the things that we thought is very important, just to quickly, in terms of how we are modeling GEMS as we support the current policy direction in terms of the realization of universal health coverage. We have modeled, as I've indicated, some of our products, particularly Tanzanite 1, as a reference product for national health insurance, in that we implemented what is called care coordination, where you have to nominate a GP. There has to be, you don't just go to a specialist. You have to be referred by a GP, and that has resulted in cost savings of about 17%, what you call downstream costs. There's less usage of hospitalization when there's care coordination and when our members use the networks. And then one of the things that is progressive about the structure of GEMS is the fact that the contributions are based on income bands. So when there are 3 income bands, those that earn lowest, in the middle, and higher. When you earn higher, your contribution is adjusted, you pay more than the lowest. It's a progressive approach to try and, for the sake of, to create equity. And then we measure ourselves by an independent, there is an independent organization, health quality measures, that measure our outcomes. And we at GEMS have been doing well in terms of, we are achieving results that are above average in most of the health indicators. Our non-healthcare costs have always been amongst the lowest in the industry, in that we have averaged non-healthcare costs. By non-healthcare costs, we mean those healthcare costs that are not paid to the doctors, the contribution that is used to run the scheme. We, on average, has always been 5% and below of contribution income, whereas the industry has generally been around 10%. So this is something that we have maintained over the years. And then from a leadership and governance point of view, GEMS has always achieved ethical and good governance outcomes, in that since inception, we have had 17 unqualified audits since GEMS was started. One of the things that came out recently is the Health Market Inquiry, which was trying to establish why private healthcare is expensive. And one of the things that was a recommendation from the Health Market Inquiry was the introduction of value-based care. We have already started implementing some of the frameworks within GEMS and seeing very good results. Value-based care is basically ensuring that members have access to quality health care without it being too expensive. So you have to control the costs, but not compromise the quality. So in doing that, the principles of creating value for the patients and ensuring that the care is organized around the patient's medical condition, ensuring that the full cycle of care is obtained by the member, and then ensuring that the outcomes are always checked. These are the things that we are pursuing at GEMS. And having pursuing this, we have established the following value-based care models. We have introduced population medicine, which is basically where we have multidisciplinary primary care systems, where we have agreed with the healthcare providers that they will see our members, ensuring that it's not only the GP, it's the psychologist, it's the dietitian, all of them act as one team so that they take care of the entire. And we have piloted this, it's working very well, and we are now starting to expand it with the healthcare providers that are participating in our population medicine. We also have palliative care, a very important part, because one thing that drives the costs of healthcare, it's the cost of dying. Medical aids pay a lot of money when at the end of life. People spend life in ICU, and then lots of high bills, and then they die. And research has found that some of these patients actually would rather be taken care of at home, and with concentrating on palliation rather trying to cure when you know that a person is terminal. So palliative care has been introduced, and it is growing, where you find that the concentration is ensuring that we give access to these members who are terminal, but they die with dignity, and in most cases, either in a hospice or at home within the family. And it seems to be something that people are starting to prefer, because it's all about dignity. So it's one of the value-based care models that we are unrolling. And then chronic and back neck rehabilitation reduces the surgery that is done for these problems. And then we have just started weight management program, which is, we also have we have established that actually within the public service, we do have a problem of obesity. And it's something that we are piloting as part of ensuring that our public service employees have access to healthcare benefits. And then as I go towards the end, one of the things that we have been faced with post-COVID is that a number of people are suffering from what is called long COVID. They are not recovering from the sequelae of COVID. And as a result, we have programs that basically try to assist our members when they consult with the doctors to deal with this sequelae, because otherwise they have a negative effect on the productivity of the public service employees. And also they tend to also have chronic illnesses that seem to express themselves even more, and there has been a surge in mental health disorders. All of these are part of the programs that we are available. And then lastly, in terms of what we are faced with as a society and as a public service employees, as I said, that the public service is a microcosm of society. We have what is often referred to as the quadruple burden of disease, and these disease categories that are a big problem in South Africa is HIV/AIDS and TB, problems that are associated with maternal and child health, which are part of the things that we need to improve for the SDG 3. Non-communicable diseases, which is basically our lifestyle diseases, and then violence and injury, trauma, that we often have our casualties being full, having patients having a lot of patients that are afflicted with violence and injuries. All of this, GEMS has got programs as listed. We have an HIV disease management program. We have access to TB screening with regard to the first burden of disease. Our maternity programs are very, very expansive, which include support from the time a person registers on the program, and then I've already alluded to the various disease management program, and then we have a comprehensive coverage for emergency medical services, which is a network of ambulances which our members have access to, and then we have been giving a lot of focus on mental health benefits, particularly post-COVID. So, in summary, Chairperson, GEMS was established to carry out a mandate to ensure that there's adequate provisioning of healthcare coverage to the public service. We aligned with the priority to improve health and welfare of public servants to create an enabling environment for productivity. We have grown to become the biggest scheme in the country, the largest closed medical scheme with 2.4 beneficiaries. On average, our contributions are 25% cheaper than similar options in the industry. And this is very important because one of the biggest challenges we are starting to face is the issue of affordability as society is faced with challenges relating to the current economic climate, the rising burden of disease, also making utilization to be more. One of the challenges is being fraud, waste, and abuse of medical schemes. We also have to deal with supplier-induced demand as defined in the health market inquiry. And then the increased demand on healthcare services due to post-COVID sequelae. All of these are putting a pressure on our affordability as a scheme, and the contribution increases also are an indication of that. Our strategic thrust is to be a strategic partner towards the realization of universal healthcare coverage. So we therefore, as GEMS, support the prescripts of the National Health Insurance Act as a means to achieve universal healthcare coverage. The GEMS model towards the realization of universal healthcare coverage in support of a phased-in implementation where there's collaboration amongst the stakeholders is underpinned by care coordination and a bias towards primary healthcare, progressive income-based contribution, better health outcomes demonstrated by an above industry and significant number of health, above industry average on a significant number of health indicators. We have amongst the lowest health costs in the medical schemes sector, that is the non-healthcare costs. And GEMS has demonstrated an ethical leadership and good governance, which is backed by 17 unqualified audits since inception. Thank you, Chair.
Wonderful. Thank you very much for that presentation. 17 unqualified audits is certainly something to be proud of. Members, I will now give you an opportunity. We will start with Honourable Kaba, and as usual, we will move down towards down the row. Members, we are slightly over time. If I could ask you to maybe keep your comments to within the 2-minute range, and questions, so that every member has an opportunity to give their inputs, and we can move along with our program. Honourable Kaba, please go ahead.
Thank you, Chairperson. Once again, greeting to you and Minister and Deputy Minister, and all protocols observed. Chair, let me welcome these two presentations. They are well and good. Chairperson, I do have a question to the National Schools of Governance. That despite the Nukela program, are there any training courses aimed to professionalizing the public sector? Chair, due to the time that you allocated us, I must shoot straight to the GEMS. In GEMS, Chair, what will be the role of GEMS after the provision of the National Health Insurance? I thank you, Chairperson.
Please go ahead, Honourable Member. Thank you.
Thanks, Chair. Good morning, honourable members, the honourable Minister, Deputy Minister, and all senior officials of our government. Let me start with the NSG. Whilst I understand that one of your responsibility is to assist in building a capable and ethical developmental state. But my question is based on that we are dealing with human beings. As much as we would wish to deliver to that, but I believe that there are efforts, considering that in the previous years, government have been assisting and supporting them, taking them to universities for capacities and support. What really needs to be done for us to achieve that and to be able to measure, to be able to be proud that we could see that we've invested in these individuals. Because I believe government have taken a lot of money in skills building, in paying for universities, but when you look at outcomes, when you look at audit outcomes, when you look at cases, for these officials, when you look on the attitude of them, I want us to balance the two. As much as we invest to them, the preparedness of them to meet what is required on them to service the people of our country. I just want, I'm not very sure whether I've spoken what I want to understand, but I'm very frustrated because the government have invested a lot of money, but we cannot see. We appreciate that NSG is making so much efforts, but the challenge is how do we measure and how do we appreciate that? Can we see whatever we have done? Then on the issue of digital skills challenges, the role of NSG in support of our officials in trying to upgrade the skills, since we would wish to move, whilst appreciating the work you are doing with the understanding. Are the department willing to work with you, or are the departments willing to transform to digitalization, as it is a challenge when you are looking in the workforce, which is there. Then thirdly, is the issue of how can NSG assist the government in the issue of RPL to be recognized and have certificates. I'm raising this informed by a number of cases of people who are having general experience, and unfortunately, when advised, go to the university without getting certificate. How do we close that gap? Because others have experience on the job. One was appointed as a assistant director years ago. Then when there is an opportunity that you can be admitted to a certain tertiary institution, one would go there, not understanding the processes undergone for him to have a certificate or for recognition. How do we move from that? Because it makes them to be frustrated, because the new generation come up with qualifications and teach those who are new entrants on the job done. Then it means, therefore, I'll remain an assistant director until death, whilst the new incumbents can be seniors to me, and I'm the one who teach them how to do the work. Can't NSG come up with a clear program of supporting those people, just to have certificates for them to get an entry level, to get sufficient or recognized skills? I didn't hear about it, but I think that's what is killing our manforce now, or our personnel now, because you are having more who have been taken. The issue of degrees and other things just come in, and we are taking them as the requirements, while there are people, and we even said they must come to level 5, you'll go to that level 5. There are people who have been there, and you come in as a newcomer to supervise this person. I believe that's one of the issues which make the people to have not to have morale to do the work. So I want us to try and align the skills which are in there, and with the new skills. On GEMS, what would you be your role after the provision of NHI how do you position yourself to be able to align yourself with NHI? Do you see that you still have a role? Then, have you ever done an independent evaluation or a satisfactory survey for your members? And what is the feedback if you have that? I've seen that you are having a progressive, so-called progressive approach, that when your salary is higher, your contribution is higher. Are the services or benefits the same? Because if you are saying, if I'm paid higher and I'm a member, I must pay more than the one who is paying low, unless I'm cross-subsidizing that one, if the benefits, because my understanding will be on benefits, because if I'm able to pay higher, why I am not given a higher beneficiary state than the other one who is paid less? Because in my view, it's unfair for different people in different categories, salary scale, unless it's clear that there's cross-subsidization, which you don't pronounce on. I want to be clear on that one. Then the other one, this it's a concern, this issue of a high number of people with diagnosed with hypertension, 355,000 people on 2 million. It means if those are in different departments, what are those departments? If you know them, if you don't know, I don't mind, but I would link it with the performance of officials in generally, because if a certain percent, 20%, those, it means those might be on leave or don't go to work as, or don't do the work as expected. That's worrisome. If you have, it means there's a lot of leave in those affected departments by those. Then it will affect the production in those departments. Thanks, Chairperson.
Thank you very much, Honourable Tikana. Honourable Ndamase, please proceed.
Thank you very much, Chair. On NSG, under Program 2, on the outcome on capable and professional public sector, there is a target there of 6 skills assessment reports on specific departments. My question would be to get clarity in relation to the rationale behind choosing those departments, and if you are able to specify them for us, I would be interested in that. Then secondly, continuing with Program 2, there are those targets that you have there, for example, under improved governance and social cohesion, where you have 40 board members of state-owned entities are inducted. My question is, can you be able also to get deeper into giving us an insight on the rationale, on the targets as you outlined there, particularly as referenced by the example that I've made? For my last question is in relation to GEMS. I have a very bad experience in terms of the medical schemes. And my suspicions is that it has everything to do with NHI. What's your view in terms of the legislative arrangement that has brought in NHI as also as a medical scheme? Do you think this hostility is justified, or you are as hostile as others? Thank you.
Thank you very much. Honourable Ndamase, Honourable Kilisha.
Thank you very much, Chairperson, and good morning to the Minister and the Deputy Minister. I think I'll start with the Prof there, at the National School of Government. Prof, I just want to know if, I think first of all, I just want to know if there are mechanisms to ensure that the curriculum remains relevant because there's always changing needs of the public sector. So I just wanted to know if maybe you've got like any mechanisms in place to ensure that you remain relevant. And I also want to understand if maybe what's the progress in the integration of technology into training programs, and how has the distance learning, e-learning improved the accessibility and inclusivity? And maybe going with that, is it compulsory for the SOEs board members to be inducted by the school? And if maybe not, how can this be made compulsory? And I just want to also understand the strategies contributed to the revenue generation, and maybe to understand if these are sustainable. I think this question goes with perhaps seeking clarity on how NSG is going to ensure cost-effective training delivery while maintaining quality. I think I'm also interested in knowing how effective the partnerships, because I know that the school is in partnership with professional bodies and universities. So I think I just am interested in knowing how effective have these partnerships been in certifying the programs. I think that should be it. Or maybe, Prof, also, how has the shift of capacity building and capability development improved the public service delivery? I think I'm interested. And my question is what measurable impact have been the ethics training programs had on reducing corruptions and improving governance? And with GEMS chairperson, I think I'm interested in how much lost due to fraudulent claims. Were there any fraudulent claims, and the interventions that that GEMS introduced to minimize these claims? And maybe this goes with maybe understanding the measure of return of investment of its disease management and wellness programs. And maybe also, can GEMS give us some real life examples of how the healthcare programs have helped save money? You know, how are they saving money? And with okay, I'm trying to see how I can ask this. I want to know, how will GEMS adapt if NHI mandates restructuring of medical schemes? Do you have any plans with the NHI coming up, if it mandates like the restructuring of medical schemes? What will you do? And maybe the last one, Chairperson, I want to maybe understand the strategies in place to ensure equitable access for the rural public servants, because those are always the neglected. What strategies do you have in place to ensure that there's equitable access for rural public servants? Thank you very much, Chair.
Thank you very much, Member. Honourable Langa.
Thank you very much, Chair, and greetings to the Honourable Minister, Nkosi Sheng, DM, senior officials of DPSA entities, fellow members of the PC committee. Let me also start by welcoming both presentations from the National School of Governance and Government Employees Medical Scheme, GEMS. My first questions are for NSG. Maybe in the interest of time as well, I won't give a brief. I'll just shoot two questions. On slide 26, NSG, what are the core objectives of the NSG's communication and marketing strategy? And how will it contribute in improving public sector awareness and uptake of training and development programs? Question 2, in striving for institutional excellence, what performance indicators is the NSG using to evaluate the success of Program 1 in advancing strategic leadership and internal capacity within the institution? I leave space for my colleagues so that they can also shoot at NSG. My next questions are for GEMS. I think it's on slide 21. What oversight mechanisms are in place to ensure that performance-based contracts with the healthcare providers within the GEMS network prioritize quality of care for public servants over cost-saving metrics? Question number 2, in the light of the long-term effects of long COVID and the progression of chronic illnesses due to disrupted care, how is GEMS adapting its disease management programs to meet the evolving needs of affected public servants? On slide 24, 25, in the light of long-term effects of long COVID and the progression of chronic illnesses due to disrupted care, how is GEMS adapting its disease management programs to meet the evolving needs of the affected public servants? And how is the impact of these wellness initiatives on employee productivity being assessed in order to ensure a sustained culture of wellness within government departments? I think I have a few more for GEMS. Maybe if you could also be briefed on what are turnaround times for processing claims submitted by medical practitioners after administering treatment to a patient. And also, is there any payment backlog by GEMS to various healthcare facilities? If yes, what could be improved to enhance the system? And maybe the last one, has GEMS investigated the root causes of why so many members claims relate to mental health, and what can be done to minimize such mental health claims for members and general public servants? And maybe in conclusion, Chair, I know the presentation was sent in a point form, presentation form, but maybe if, because we at times we also print the papers, maybe if the numbering as well, because numbering will assist us in terms of referencing. Yeah, thank you very much, Chair.
Thank you, Honourable Langa. Honourable Potgieter, please proceed.
Thank you, Chair, and greetings to the Minister and Deputy Minister and the officials. Just with regards to the NSG, I'll make this a quick question. I've been asking a number of questions in Parliament, and I'm trying to understand the sort of lack of coordination. This is possibly not a question for the NSG so much as the department. But we are all involved in the professionalisation of, national and provincial government, but it doesn't seem that there is a centralised dashboard where we are measuring the upskilling, training, education, etc. of staff. The productivity in national government and particularly provincial government is slowly decreasing, but all of these entities and departments are putting more and more money into education. More and more employees are going through to the National School of Government, to be trained on various things. But it doesn't seem that you can get a cohesive document that says, okay, we've done a skills audit, these people need to be trained on X, Y, Z. The NSG is going to prioritize these departments because they're experiencing the most problems. And these staff need to go for actual further educational and I've done this over several questions, and every time I get referred to asking all of the departments and all of the entities across different spheres of government for all of their information so that I can collate it. And I'm okay with that, but it makes me wonder if national government as a whole actually understands its professionalization needs, because it doesn't seem that you are able to measure the money that you're plugging in and the training that you're plugging into the staff. You can't measure it. You can't determine the productivity or whether or not it's working, and et cetera. So this is why I say it's probably a holistic question and not necessarily for the National School of Government. With regards to GEMS, Chair, I don't know if it's possible. Oh, sorry. Let me just go back 1 second. Would it be possible for the NSG to take us through the Unyukela program and possibly even the NSG as a whole? I'd like to properly understand what an official goes through when they do the program. What are the requirements? Does everybody answer the same questions? How is it safeguarded from being done by somebody else, etc.? And also the capacity that the NSG has for all of these staff that come and do training. It's just easier for us to assess what it is they're all about. At the moment, I feel like I'm talking about a fictional place that maybe exists on the internet, and we don't quite understand how it works. Then in GEMS, is it possible for us, Chair, to get the financials or balance sheet for the medical aid? It's difficult to assess what they're talking about in terms of, the 25% less contributions. I don't see how that's financially feasible in the long term, and I think one of my colleagues mentioned that they're dipping into reserves. Over time, it's not going to work. And what happens to these officials when this no longer works because it starts running out of money? So if we can have an understanding of what officials are on the medical aid, how much money is being spent, how much is being paid out, but also the different gradings of employees that are members versus the contributions that they're paying in relation to their salaries. It is quite concerning, and I suppose in government it does happen that you have people with hypertension and mental issues with regards to their job. Is GEMS collating this info, and how are they feeding it to the department so that they can apply this in terms of their wellness program? Because it's only so good, saying that we're treating 355,000 employees for, hypertension, but what's happening on the back end of that? How are we preventing that from happening? Then the increase of 43.1%, where you talk about your flagship options. If you can just expand a bit on the reasons for such a drastic increase. And if you can give us more of an explanation on the reduction of co-payments. Are you implementing gap cover, or how are you managing to reduce your co-payments so drastically? And then your better healthcare outcomes. Do you have some sort of analysis that is able to give us a sort of 5-year period or similar of how health outcomes have been better on average in terms of the interest, in terms of the industry? Your government versus staff contributions, if you can explain that. And then again, the chronic illnesses, the mental health disorders. I just want to understand how you're reporting to DPSA so that they can implement that. Your female healthcare, and I've seen this across government, there tends to be a focus on maternity and child health. And then it's like women don't exist after they've had babies. Whereas in fact, most of your female or issues that you have as a woman happen after you've had babies. What government medical aids don't cater for are, a lot of things that women need to go for, particularly after the age of 40. And they don't cover most of it. So I'd like to understand the capacity of your female healthcare. And I think that, that's a Chair. But I think, going forward, it would be useful for us to be able to see the financials of the medical aid. Thank you.
Thank you very much. Honourable Matutu.
Thank you, Chair. Good morning, Minister, Deputy Minister, officials, also my colleagues. My question is School of Government program. Unyukela Professor. Diaguva apa uteta kama leaders, chiefs, train now. What about those ones are non-recognized by the state? They never have a opportunity. Soloko bona bebekelwe ecaleni. Ngaba bona ba benefita phi kule training kwezi programs kanyukela. Umbuzo wami nje ulapho. Thank you.
Thank you very much. Honourable Malinga.
Thank you, Chair. Unfortunately, I'm the last person. So when the chairperson was starting, the dish was full. So now I've got few in the in the dish, but let it be. Firstly, let's appreciate the presentation from NSG. We really appreciate from GEMS. Thank you for giving us this information. Although, as my colleague have stated, we will appreciate, especially from GEMS, that in future, let's have the full details of the presentation, especially when it comes to the financial issues, so that we will make the comparison accordingly with an informed position. Maybe let me start with the NSG. I just want to check that how can the curriculum be updated to better align with the current public service challenges and future government trends. For example, the digital transformation, climate policy, ethical leadership, etc. Number two, what partnership with university, international institution, or private sector expect can be developed to enhance training quality, innovation, and global relevance? Because of the time, the last one, I will double check with the chairperson if he will give us a chance to submit some of the question in writing, because I've got a glossary questions here, so I don't want to waste your time. The last one will be, how can the school measure and ensure the long-term impact of each program on public sector performance and service delivery outcome? That will be my questions when it comes to the NSG. Let's have chairperson, let me take only 4 questions, because in my list I've got 16 questions to GEMS. Yeah, but let me take 4 only. How will the integration of GEMS into NHI framework affect the benefits and coverage currently offered to government employees? That will be my first question. The second question, what measures will be taken to ensure a smooth transition for GEMS members without compromising access to quality healthcare? And how will be the financial sustainability of GEMS be maintained or restructured under the unified NHI funding model? Then the last one, in what ways will GEMS existing infrastructure and administrative capability be utilized or transformed to support the implementation of NHI? The last one, I just want to check in terms of the membership, whether your membership is growing. If the answer is yes, it's fine. If the membership is declining, is there any reasons? Is there any mechanism that in your institution you make the follow-up for those members why they are terminating or resigning from GEMS? Thank you.
Thank you very much, members, for those valuable questions and inputs. Members, just to also respond to Honourable Malinga's suggestion, If any of your questions remain unanswered or you have more questions, you can send them all in writing to the committee secretary, who will make sure that it is sent on to the different presenters or departments for written answers. With that, I hand over first to the National School of Government professor, and then we can move on to GEMS after that for comments and answers. Thank you. Please proceed.
Thank you, Honorable Chair and Honorable members. I will answer few of the questions, and I'll ask my team at the back to respond to the other question. So, professionalizing the civil service is an important pillar of priority number 3 of government, and of course we are responsible for executing the HRD aspect of that. Of course, there are systemic issues in the system, as they are and as we are aware in many organizations, but I'll explain some of our attempts to change the dial as it were. So, and I'll make an example because it will connect with the subsequent questions. We have recognized that pulling out an individual to train them on SCM and finance in a large department will not necessarily have a major impact in how the department performs on the financial management matrices. Most of the feedback we got from officials who go for training on SCM and finance, they will say, I have been empowered through this training program. However, where I work, decisions of procurement are predetermined. And so what we are trying to do now as part of our targets over the next term is to change how we provide training support on critical areas such as SCM, project management, and finance. By doing so, for example, using some of the departments that are worst performing from the AG reports point of view, we believe that if we train everyone in an SCM or in a finance directorate in a department, you become more institution-wide. You support the whole ecosystem responsible for managing procurement in a public institution as opposed to taking one similar individual. We will then track that to see whether their audit performance changes over time because you have provided training to everybody. I say this because this is the feedback we are getting. Officials come and do the project management training with us, which is accredited. Later on, Honorable Chair, they come back and say, whilst I feel empowered, in the environment where I work is an extremely chaotic culture in my institution. And those are variables we are not in a position to alter as an organization because people come to us voluntarily. Hence, this new approach of being more institution-based, especially in areas such as finance and project management, because once you change the culture in an SCM, and we know about the AG, the public protector and others have written reports about systemic challenges in SCM and finance in some of the departments. Of course, this will extend even to how people are managing contracts, which is why in some cases you have a department paying 95% of a project budget when the project is only 40% complete. And so when you intervene at an institution level, we believe that we can change how this thing will work. And then, as I said, focusing largely on SCM, project and contract management, because those are the burning platform areas in the public sector at the moment. We are building an RPL assessment center as part of our key outcomes for this current term, because we've recognized a few things. I mean, in a university where I associate with, members ought to remember, if this was a classroom, a lecture hall, we wouldn't know who came to this lecture hall through RPL. So how we deliver training and assessment is the same regardless of whether or not you came here through RPL. And as a consequence of that, some of the candidates who go through the system through RPL, they do not succeed because you don't know who got RPL, who got a distinction and anything else before they came into this lecture room. So in the manner in which we are designing our RPL system and RPL center, it includes supporting people to succeed beyond admission into a program. Also to discourage this idea that if you do RPL, everybody wants to do a master's when they do RPL. That is a problem. It's a disadvantage. If you have never written a 5-page essay, why don't you do RPL and begin at a diploma level and progressively move across? Because your chances of success are greater if you do it this way, as you are stepping up, as opposed to moving straight into the masters as some people do. Then you struggle even with an assignment, and that is why many of those candidates end up failing. And I'm saying this knowing full well that there's many members of parliament and legislatures over the years, supported by the EU initially when the legislature beginning, who went through RPL processes, who graduated all the way up to PhD, because the approach that was used to support them at that time was different to the one of parachuting to NQF level 9. At the time, you were supporting people through a learning pathway, taking a long-term view so that there is quality. And that is how we are designing our RPL system, so that we don't expose members and other public servants to challenges later on. And on this question around the measuring and performance, we are very clear about it. In fact, we as an institution, because there is a culture that has been established over time. When I go to the NSG, it had received clean audits for 10 years, so we've done 15 plus. Now the institution was strong. It was just underutilized, but the institution was strong, which was an advantage that one had when I joined 5 years ago. But there is few things that matters for us. One, Honorable Chair, is about how you lead an institution. Hence, these colleagues who are here, who are providing leadership for various elements of the institution. In many instances, I mean, and I apologize for saying this in front of my minister and my deputy minister, we are just not being held accountable as senior managers. We're not. I mean, we are not being held accountable. We are not being asked questions. So I could ban $1 billion in an institution, it get lost, and I will ask a very friendly, nice question. I give you a half-hearted response, and it ends there. So we are just not being held accountable. That's where the first problem is. And secondly is around how you manage performance. I mean, what do you want from me as a committee? What does the minister, what does the president want from? So the whole cycle of managing performance for people who are leading institutions, that is a problem. We are doing, Chair, training on board members of SOEs. It's not yet compulsory, Honorable Kedisha, the training of board members. And apologies, it's 40 boards, not 40 board members. It's an error. It's 40 boards, so there's a number of institutions and not necessarily years. We are training them. In those interactions, you realize that even the type of governance that is there in some of these institutions is a problem, because they're not answering the core questions that ought to be asked of the executive, of the principal officer, for an example. And as a consequence, a lot of wrong decisions, wrong things get taken. In future, Chair, you will be amazed if you were to peruse the minutes of board meetings, because those minutes could tell you that what was this board preoccupied about? Was it issues of leadership, accountability, efficient service delivery, and so on. In our instance, the minister, as I said, is changing the metric. He is asking us about impact. So the next 5 years will be difficult, because we want to see whether those SCM officials we've trained, if they improve the audit outcomes in the department, and those who are on the front line, whether or not they are providing a service, where they are providing a service differently. And that is how we're looking at issues of quality as well. Of course, we are dynamizing our curriculum. We have, for example, changed the curriculum since the formation of the 7th administration, because it's got to be updated, it's got to be upgraded. We recognize that we've got limitations as an institution, Honorable Lady. So we've got up to so much capacity that is reflected in our slides. Of course, we have a network of departmental trainers and others who are independent trainers. So what we have decided to do is to strategically partner with universities, locally and internationally, and also to bring some expertise. I know for a fact that our board induction program, it does not compare with any, because we've got Michael Katz and Marvin King and Cindy Koyana, who are part of the people who are providing training on our board. And as a consequence of bringing those expertise, we've got depth, and we have the capacity that otherwise we wouldn't have within the institution. I know that we are providing training as part of the future skills with Stellenbosch University on scenarios. We're providing training on design thinking with CPSI and others, as I said, on climate resilience. And by partnering with OEMs like Huawei, Microsoft, and Amazon, we're able to provide these digital training skills into the public sector. And by doing so, we are more responsive in dealing with the future skills that are required. And of course, as the cabinet has directed, we are training on focusing on training of CFOs in the public sector, as well as several others. Finally, Nyugela is an important program. We are progressively building towards a government-wide compulsory examination system by 2030. That is what we are hoping to have. Maybe, Chair, we could do a challenge where we say all honourable members must do Nyugela. You've got about up to 6 months to do it. Your engagement as honourable members with the cause in Nyugela will give you a sense of where we come from as a school, what our ideological underpinnings are. We're extremely ideological. Chapter 10 of the Constitution is our ideology. Chapter 10 of the Constitution. And so when you are engaging with it as members, you will be able to interact and see where Nyugela is. Finally, Minister, the Nyugela that will be introduced in the next 3 months will differentiate between the Nyugela that must be done by someone who's a DDG and DG or CEO, as opposed to Nyugela at a director level, because the level of complexity is not the same, and it is moving towards a fully fledged exam system as they do in Europe, Asia, and elsewhere. But I wish to make an invitation that maybe through you, Chair, that the committee should actually do Nyugela and give us feedback, because we are building the system, as it were. If I may request the CFO just quickly on some of the finance stuff and the DDG for training, and then lastly, Dino, in a minute each, please. Thank you, Chair.
Thanks, Chair. Thanks, Principal. Thanks, honourable members. With regard to the issue around the cost saving and also the sustainability within the institution, the year on year, when we do our planning, we take into consideration which are the costs that make revenue, and then we put those ones upfront, and then which are the ones actually that are not making revenue, but we offered for free, which are on the platform that we have within the institution. And also we take into consideration the increases. We normally write letters to National Treasury in terms of the increase, so that we then apply inflation. And then the other one is the business that when we go out, do business development within institutions to increase the existence of NSG. That's actually what we then call the businesses for the NSG to expand more. Thanks.
Okay. Good morning, Chair and honourable members and Minister and Deputy Minister. On some of the questions, Principal has covered, but I just want to add all the programs that we have at the NSG are aimed at professionalizing the public service. It's to make sure that we equip the public servants so that they are able to be responsive and they are able to do their work. On some of the question that was looking at the shift, where we are looking at making sure that we reduce corruption because of the ethics programs that we deliver. One of the things that we are trying to do with our courses is to level the playing field so that everyone works from the same script. If we're talking about values, everyone has the same kind of values when they interpret them, so that they know what we mean when we say something is unethical, and then they can be held responsible for not operating in an ethical manner. So that will be what we're trying to do. So then the departments are able to hold public servants accountable based on the training that is provided. Most of our programs are not compulsory. We do have a list of compulsory programs. Even for SOEs, it is their choice to come to us, and we're seeing they are slowly taking up some of our executive education, including the induction of boards. And this is what we want. We do provide some, we've already integrated the e-learning on all our programs. So the departments have a choice whether they want facilitation virtually or they want face-to-face, as well as they can do programs that are completely online, self-paced. So they are open. Those are limited programs, but we are slowly adding a lot more on those programs that allow cost savings and accessibility for public servants to access those programs. The e-learning has made it easy for lots of public servants to access training without having to go through the approval system, especially the open e-learning programs. So as the CFO spoke about the issues of funding, some of those programs are made accessible because of the funding we get from National Treasury. Some of the programs they have to pay for to access the training from us. Oh yes, on the issue of updating our curriculum, we ensure that curriculum is updated on as and when things happen. We do have to review programs every 3 years, but as things change, as Principal indicated, we change. We do have a program that caters for climate change, disaster management, as Principal mentioned earlier. So as things change, we do bring up programs. So we're always looking at what's happening and making sure our programs are current and address the needs of the public service. Thank you.
Thank you, Chair. Maybe let me start with the issue of the digital skills. Are departments willing to work with us? Are they digitally transforming? I think the Minister and DM have been very clear with us as the NSG that we must make sure that digital transformation takes place. And for the school, that's very important. What we can indicate, Chair, as part of the partnership with Microsoft, we have, we held 2 AI webinars. And in those 2 webinars, we had seen in excess of 500, registrations from public servants. So we think, yes, we think public servants are ready. We think departments are ready. And so as the NSG, we have to be ready with the programs. And I think we have that responsibility, going back to what Minister said, how do we reach frontline staff? We have to make sure that our digital learning programs, reach frontline staff at the same time, being able to build the digital leadership skills. I think on the point, Honorable Damase, on the skills assessment, that was part of a presidential pronouncement. Where in the reply to SONA, I think it was 2 years back that President Ramaphosa said we must work with the HSRC to conduct skills audits with frontline and the infrastructure departments. So these are the departments that we are working on. I don't have the full list, but we can make that available. There are departments such as water and sanitation, Department of Transport, and so forth. So that's the skills assessments that we're working on. On the integration of technology into learning, I mean it's important for us. There is a program that we that we do run, that we work where we expose DGs, DDGs within a flight simulator that allows them to to understand how to plan the implementation of the APPs, as an example, very similar to a flight plan. But part of this digital transformation for us is to have our own simulation software at the National School of Government, so that we're able to expose public servants, the leaders towards this type of immersive learning. On the issue regarding the brand and communication, Honorable Langa, I think what we have done, we've been growing over the last 5 years, our brand and communication. Certainly there's a lot of work around social media, the mainstream media. We're starting to expose more of the senior managers towards interviews, participating in media engagements, our exhibitions, and so forth. So that's really part of the broader brand and communication strategy that we are pursuing. how do we measure the effectiveness of the NSG is an important one for us. As we now move to the next 5 years, it's important for us, as we have done today, to take stock of the last 5 years. There is work, the DPSA does have a framework on the organizational functionality assessment that departments have to do. So we'll be conducting that in this financial year, really looking at how the organization has been performing and doing that assessment against the criteria for that. So that's the work that that we'll be doing. Honourable Potikater, I think it's very interesting on the dashboard. We'd also be keen to engage and try and understand on that. Thank you. Thank you, Chair.
Please proceed. Thank you.
Okay, thank you very much. Good morning, Minister and Deputy Minister, and honorable members. There was a question on traditional leaders. I just want to mention that we go into collaborations with other departments, such as your Department of Traditional Affairs, Provincial COGSTA, Rural Development, and Provincial Houses of Traditional and Khoisan Leaders. And this is to ensure that we train leaders that are recognized by the state, because there is a fee that is payable for the training that we are doing. And these partners are the one who would be paying for the leaders that are coming through for our training. And for those that are not recognized, some of them would come through other formal structures, like example, your contralesa, and they would be coming through with their own private funding. And private funding can be either from the mines or one of the private sector companies that would be paying for them to go through the training. And sometimes we receive those that are coming through their own tribal councils, and they request training, and they would have their own funding. Thank you very much.
Thank you. I think that concludes the speakers from the NSG. GEMS, please proceed. Thank you.
Thank you, Chairperson. As the board chairperson said in the introductions, I'm also accompanied by colleagues, Dr. Vuyo Gola and Ms. Karina. Dr. Vuyo is our COO, and Ms. Karina van Lingen is our CFO. They will be assisting with some of the questions that have been asked. So I'm going to take some of them and then also hand over for some of the questions that they will be addressing. So the first question actually repeated itself almost 4 times. What will be the role of GEMS after the implementation of NHI? And then it was asked in various fashions earlier. What would be your role after NHI? And then towards the end, it was also how will the integration of GEMS into NHI affect benefits? So what happens is that, as we all know, that the NHI has been signed into an act, but sections thereof, not all the sections have been promulgated. The regulations have been published for that deal with the governance structures. That's where we are. The government employees medical schemes is a product of legislation. So at the moment we operate in terms of the Medical Schemes Act. And then when policy is changed by yourselves, the legislators, we are the implementers of whatever is ultimately decided. And this is something we cannot predict as an implementer. We are implementers of policy, of what the law says. We act at the moment, we operate in terms of the Medical Schemes Act 131 of 1998, and as best as possible. Whatever the outcome of all that is happening in terms of policy changes towards the realization of universal health, we adjust at GEMS accordingly and implement according to what our principal, in this case our minister, we here as an implementing arm of what the priorities of the minister are. And whatever, so when you look at the NHI Act at the moment, it talks about the role of the medical schemes will be complementary when the NHI is fully implemented. And this will be proclaimed by the Minister of Health when that happens. And we don't know when that is going to happen. So it's a very difficult question to answer to say we see ourselves as doing ABC. However, what GEMS has been doing in terms of its strategy is to say policy is changing. The country wants to go towards universal healthcare coverage. What is it that we have learned over the past 20 years that we can offer the employer, our minister, the government, to ensure that universal healthcare coverage? So our strategy is to come up with things that are done in an environment where you implement universal healthcare coverage. So we are doing programs that ready your government employee GEMS in the future for an environment where NHI is being implemented. And then if you look at the strategic thrust that says to be a strategic partner towards the realization of UHC, we interact through the DPSA with the Department of Health to try and say, this is the role that we can play. As you come up with regulations and tactics and implementation of UHC, whenever that everything will be agreed to, we will be ready to can help you in this manner, whether it be actuarial, whether it be case management, whether it be benefit design, whether it be finance management in an environment. All of these things are the skills that we have acquired over 20 years, and they are there on offer. So that's basically the answer to those 4 questions that relate to NHI. Have you ever done a survey of our members? We survey ourselves constantly. So we have a monthly member satisfaction survey that is initiated by ourselves, GEMS. So essentially what it does, it tracks a subset of members who have used GEMS services in the past 6 months. These members are surveyed, different members, and we monitor the results. We have a target that we set based on benchmarks, which basically we always want to score 90 and above. There are times where we dip below that 90. 90 is a good score generally in a survey. Then it's 2 scores, it's your net outcome and the net promoter score. Those are the 2 ones that I use. There are instances, a medical scheme is a very emotive business. Sometimes we go through, if you survey people towards the end of the year where most of them benefits are starting to be exhausted, they give you very, very bad scores. So there are various things that influence the outcomes, but our target is that we should always be around 90 and above. So it's something that, then there's the other survey, there's an industry survey that we participate in on a yearly basis. That's an independent survey where we are compared with other schemes. Then there are other questions that I'm going to skip that will be answered by my colleagues. What is your view, and I think this is from Mr. Damas, what is GEMS' view on the introduction of NHI? There is hostility. Is GEMS part of the hostility? The answer is no. We're not part of the hostility. I'm assuming that hostility is court cases and all of those that are happening. Because we have been asked this question. There are court cases and GEMS is not part of any. In fact, in the presentation, I would have thought I had answered the question proactively in the presentation where we basically clearly state our support for the NHI, where as a vehicle towards realizing universal healthcare coverage and also recognizing the challenges that have to be overcome. But I think the narrative has been very clear that the implementation of NHI is not an event. It's a process that is going to come in a phased in, recognizing that we have to overcome all the hurdles that are along the way. And I think that's where everybody is in terms of, yes, universal healthcare coverage is where we must go. There will be hurdles along the way. There's no country that has implemented national health insurance as an event. It always takes place, and we've all come to accept that that's the case. So we support the implementation of NHTA towards the realization of universal healthcare coverage. How much is lost due to fraudulent claims? In South Africa, there's nobody who has done a study, research that actually gives us a very clear indication of how much is lost to fraud, waste, and abuse. However, there are estimates that have been used, and the one that is usually widely quoted is the one that says it is estimated that anything between 5 and 15% of claims could be fraudulent. Now, what we normally do, we then say, well, if we're not sure, the range is quite wide from 5 to 15%. What is the middle of that? It's about 10%. So generally it is thought that we could be losing, and these are estimates because, as I say, nobody has actually done the actual research. We could be losing about 10% of to fraudulent claims. Now, the medical schemes industry is, I think, around 250, thereabout, 280, I think. Let's use 250 billion. Then 10% would be 25 billion is lost to fraudulent claims. GEMS pays just under 60 billion rents. At least in the past year, we paid about 58 billion in healthcare claims. If 10%, as we said, is lost to fraud, it means about 5.8 billion is lost to fraud. That's very significant. So fraud is a very, very big issue. And there's a lot of work, and I would imagine that committee members, you are aware there was a Section 59 inquiry, which we're still waiting the outcome of. It had to do exactly with issues around fraud. What strategies are in place to ensure that there's access to health by public service employees, especially in the rural areas? Our networks are actually have a footprint throughout the country. The way we have our members having access to healthcare providers is those arrangements that I explained about the networks. Naturally, what happens with healthcare providers, professionals, they will aggregate to the metropolitan areas. And it's something we as GEMS do not have control on. However, we do enter into this network arrangement even with the doctors in the rural areas. And our provider liaison office actually travels all over the country to make sure that we engage with the healthcare providers to ensure that they give services to our members, particularly with a view to reducing the issue of co-pays. So that's basically. At this stage, I'm going to ask Dr. Vuyo maybe to take the questions there.
Thank you, Chairperson. What I will try and do is also combine some of the questions that had a common thread. For example, the hypertension and as well as what we're doing with regards to just the increasing prevalence of chronic diseases and how this affects the productivity of the public servant. So generally, hypertension is quite prevalent. And if you look at studies in South Africa, for example, 45% of males and 48% of females over the age of 50 are hypertensive. So South Africa is no
different to any other countries, and neither is GEMS. There's various reasons why people develop hypertension. I'm not going to go into too much technical detail, but genetics have a large part to play, as well as age, as well as lifestyle-related, our way of living, unhealthy eating, obesity, and being overweight, smoking, and a whole lot of others. So the way we live our lifestyle also makes us prevalent to hypertension. There's a concern that this obviously will have an effect on employee productivity. So how do we tackle this as GEMS? Because we do have a large population of hypertensives. First is through education and awareness. So we communicate a lot with our members through our social media platforms, through our wellness days, as well as printed media that we send out to our members, such as newsletters. We actually work with the employers to go into the wellness days to screen people. And the focus of this is really to make sure that we intervene and we make sure that people get the care that they need earlier rather than later. Over and above that, when we go into the workspace and we do the wellness days, we get the data from all GEMS members. And we have an active disease risk management team, which is a team of nurses that will then actively call those members to follow up on them. We try and educate members to get registered for any chronic disease, be it hypertension or diabetes, as early as possible, because the earlier you manage any chronic condition, the better the outcome. So does it affect productivity? To a certain extent, yes, but what we focus on to make sure that we've got better outcomes is that we contract with our network providers on better outcomes. So if a healthcare practitioner is looking after, let's say, 50% of their patients have got hypertension, diabetes, which, by the way, chronic illnesses hardly ever occur as one. So it's unlikely. Most people will have hypertension and diabetes, or diabetes and something else. But what we do with our healthcare practitioners is that we make sure that we contract on outcomes. So the better you manage your patients, the better you get paid. So they get incentivized for better outcomes to try and reduce the hospitalization that is related to chronic illnesses, such as hypertension and diabetes. So the better the outcomes, the healthier the members. The less money we have to spend, and the more productive the public servant. We do share quarterly reports with the DPSA. And the reports are quite extensive. They are broken down into province and departments. Of course, we have to be compliant with the POPIA Act to make sure that we don't reveal the names of people, but we do ensure that we focus whatever GEMS day that we have in a particular province will be focused on whatever is prevalent in that province. We also focus on primary health care. There was a question about what are we doing to manage the risk and other chronic diseases. I did mention that the focus is on primary health care and on prevention. Yeah, I think that's it on the chronic hypertension, chronic disease and hypertension. Women's health. The honourable member asked about women's health. Yes, we do not just let go of women after pregnancy. We actually have quite an intensive communication strategy for women to go for pap smears, to go for mammograms. And what GEMS has done is that any screening tests comes out of risk benefits, which means members will not have to use their savings or their day-to-day benefits. So we do a lot of work with the members themselves in educating them in terms of what you need to do, how you need to look after yourself, how you need to do breast examinations, that you need to go for annual mammograms after the age of 40, also do pap smears on an annual basis, do bone density tests, and a whole lot of other tests. So active communication with members in terms of how they can take care of themselves. of course, whatever we do, we communicate with the healthcare practitioners as well, because members listen or patients listen to their doctors more than they listen to the medical aid. So the doctors are also made aware of what is available from a screening and preventative perspective. A lot of the focus as well in terms of paying doctors for performance is on doing some of these preventative measures and screening measures for women and for chronic diseases as well. What are we doing in terms of co-payments? The reason why we contract with healthcare providers is that once you are contracted, then you are bound by the terms and conditions of that contract with the medical scheme, meaning you can only charge at contracted rates. You cannot charge over and above, and this is inclusive of PMBs, which are a big problem in the medical aid industry. So we have an extensive network, starting from the primary care networks, GPs, pharmacies, dentists, optometrists, specialists as well, and as well as hospital groups. So we do have an extensive contracted provider networks to make sure that we minimize co-payments for members. We do inform members of which doctors or healthcare practitioners or hospitals that are contracted to GEMS to make sure that they do not incur out-of-pocket expenses. We also have what we call ex gratia, which is grace funding. So any member that is ill to the extent that they have exhausted all of their benefits for the year, they then get assisted by the scheme as additional funding. This is not a benefit entitlement, it's grace funding from the scheme. One of the things that we are faced with as medical funders in the South African industry is the unregulated space in the healthcare provider environment. So if I am a physician and the average consultation fee for a physician is 1,000 Rand, and I feel that my outcomes are so good, or I charge 3,000 Rands. There's nothing that prevents me from doing that. So what we try to do by contracting is to make sure that doctors don't charge over and above. Do all doctors join funder networks? No, not all of them, but we print the list of all healthcare networks to make sure that members are aware of which doctors are contracted to GEMS or not. With the hospitals, we do negotiate rates on an annual basis with the hospital groups to make sure that there is no out-of-pocket expenditure. Do we have gap cover? No, at this point, GEMS does not have gap cover. We do encourage our members to apply for ex gratia anytime that they incur any additional payments. Why the 43% increase in membership on the 2 flagship options? So the 2 flagship options, which is Emerald Value, which is a sub-option of the Emerald option, as well as Tanzanite One, are underpinned by care coordination. So members are required to nominate a GP as their first point of contact. So the emphasis is on primary health care. So go to your GP, do not go to a specialist unless you are referred by your GP. So what this does really is it reduces the unnecessary cost of health care. If you are being looked after by 1 GP as opposed to 5 GPs, your outcomes are better because your GP knows and holistically can take care of you because he's more aware of whatever it is that you're suffering from. So as a result of the care coordination alone, we've got a decrease, about 25% decrease in hospitalization, a decrease in specialist costs. And it's not that we don't want people to see specialists, we just want people to see specialists when the need is there and prevent unnecessary specialist consultation. What this does then is that GEMS would save around 900 million just from Emerald Value alone. That goes back to the member in the form of lower contributions. So members would join these options that are cheaper than others. We also redesigned our Tanzanite One option, the second flagship option, from what we used to call Sapphire. It was to improve coverage, especially in the primary healthcare sector and the private primary healthcare sector. There's unlimited primary healthcare visits, Dr. Stan did mention that we do have fraud, waste, and abuse, but these members have unlimited primary healthcare visits, so they can go to the GP as much as they want. However, because of the fraud, what we've done is that we've now limited to 16 visits, and then after that you have to get pre-authorization. Doesn't mean you can't go, it just means that you have to be pre-authorized. Now, these options have grown significantly, which is why the 43% increase in membership, because of the cost, because of the care coordination, but also because with the redesign of Tanzanite 1, we were able to cover previously uncovered lives. So, and GEMS has a broad definition of what a beneficiary is. You can cover your grandmother, your grandfather, your niece, nephew, as long as they are financially dependent on you. So a lot of the growth that we have seen in the past 4 years has been as a result of Tanzanite 1 and Emerald Value and the benefits that I've mentioned. Long COVID is still a concept that is not really fully understood because it's not a condition, it's a collection of various symptoms or conditions. It can range from people with memory loss to, fatigue, chronic fatigue, headaches, and things like that. What we do is we make sure that our benefit structure speaks to the needs of our members. Mental health. Unfortunately, mental health also has been quite prevalent since the COVID pandemic. We are trying to work with healthcare professionals to make sure that we are more proactive. We never used to have mental health screenings in the wellness days in the workplace before, and now we are implementing that. We're also working closely with the doctors to make sure that there is follow-up. That members also get the necessary psychotherapy that they need in hospital and out of hospital. I think I've covered things.
Please go ahead.
Thank you, Chairperson, and good afternoon, Minister and Deputy Minister and committee members. I'm going to respond to the first question on progressive contributions and if benefits are the same. So yes, benefits are the same. So even though if you have a lower salary, you will pay a lower contribution on the same option with the same benefits. And our options are structured on the basis of social solidarity, where the young and healthy cross-subsidizes the old and the unhealthy, and then the higher income members will cross-subsidize the lower income members. The question on the turnaround times for claim submissions. So in terms of the Medical Schemes Act, providers have 4 months after rendering the service to submit the claim to the scheme. In terms of the scheme's turnaround times, claims are processed within 30 days, and the scheme does pay providers every second week. So there are 2 claim run payments in a month, and claims received by the scheme is processed within 30 days. Are there any payment backlogs to facilities? There are none that we are currently aware of. Then the question on the annual financial statements. Our annual financial statements is available on our website. It is public information. From the annual financial statements, the committee would see that the scheme is in a financial sustainable position and has been over the last 20 years. The comment around the 25% less or more affordable than other schemes. So this analysis is performed on the basis of looking at value for money that members receive in terms of what you pay and what benefits you receive in comparison to the industry. And this is possible based on, I think my colleagues have mentioned, the low non-healthcare costs that the scheme manages. Dr. Vuyo has mentioned the negotiations that we have with service providers, the networks we have in place, as well as the care coordination within our environment. And all of these contribute to the fact that we are able to offer more value for money to our members. Contributions versus salaries. So how much of an employee's salary is paid towards contributions. We also do this assessment annually to ensure that We are aware of the impact on members. The last analysis was done in early 2024, of which the outcome showed that on average 8% of your salary is paid towards medical aid contributions. I think that covers all of the questions from my side. Thank you.
Thank you, Chair. I don't know if there's anything. We have tried to cover everything. If there's anything, we'll hear from you. Thanks, Chair.
Sorry, Chairperson. Maybe just the last one. I'm just interested. I forgot this one when I was asking questions. Is GEMS owned by government? Because when I was reading up yesterday, there's a confusion. I need clarity on that, because it then claims that it is working with government, but it's independently ran or something like that. I just want clarity on that, Chairperson.
Thank you. I'll allow the question and the answer, and then I'll give the Minister and the Deputy Minister also an opportunity if they would like to just comment in closing. Thank you.
So, GEMS is a medical scheme. Medical schemes are owned by members. However, the government employs medical scheme. The members.
Don't be diplomatic. Please talk to members of parliament. These are people who want to know.
Yes.
And take them through, please.
No, I'm doing exactly that. So thank you, Deputy. I'll try my best. So the members of a medical scheme. So everybody, like GEMS has got 890 members. According to the Act, those are the owners of the scheme. But what we must realize is that GEMS is established by government as part of a benefit of government employees.
That's the starting point.
Yes.
GEMS is established by government, earmarking public service. Let's leave it there.
Okay.
Yeah.
So, yeah,
we'll have a session at some point.
Okay.
I think it's, thank you very much, Chair, and thanks to the Minister. We are mindful of time for the Portfolio Committee, but also I wrote a note to Dr. Stan just to check whether it's his first appearance, not him, but GEMS. And I could realize that GEMS has not been coming to Parliament. Remember, we are also new in the 7th administration, so they may not be knowing some of the, or had a privilege to interact with you at some point. That's one of the things. So what I will appeal to you, Chair, is that beyond this engagement, especially on issues of NHI and how you guys want to, not you guys, honorable members want to understand some of these things, it will be important to suggest, Minister, that this Portfolio Committee and the Portfolio Committee on Health and the 2 select committees of Public Service and Health have a joint meeting where you sit just to understand GEMS broadly, but the state of readiness of GEMS to NHI. Because already GEMS has committed that they want to be the leading partner into NHI. And precisely because it's a government employee medical scheme. So I'm suggesting that let's have that session where you have a broader understanding of GEMS, how it operates, and all other related things. That's the first suggestion. The second issue which we have also picked up, Minister and I, is that we're tabling APPs and 5-year strategic planning plans. But if you look at GEMS, the cost of the APP is not attached, which is the financial. And we know that Parliament will not accept that kind of a situation. So we beg him for indulgence, but Minister will guide on that, to say between now and before the due date, how do we come back as DPSA and table how they are costing their APP so that we also close that gap, because it's something that we have picked up. But Minister will also guide on that. Now, on the challenge that members have identified, especially with how NSG is training and impact, and how our public servants are working and so on, which is something very close to the minister's heart, to say we want public servants who are proud to serve our people. And as we do all these NSG programs, as we look at enablers that we've created, part of it being GEMS, why are our public servants not so motivated and so on? So these are the things we're looking at as the minister is guiding. But one of the things that we have looked into, which minister was leading this year, during the negotiations, the salary increment negotiations, one of the things we picked up is that it's not only about salary increase, it's also about other enablers. Many public servants can't access housing. And it's not because they don't have money, it is because of the debt challenges and the ITC issues. So the money is there, but they can't qualify. And this then creates your impact to be a productive public servant. So those are the things that came after the negotiations. And Minister then said, in the next 6 months, how do you then come with a program that will help public servants on housing, but also those who are in the danger allowance, you know, the danger allowance for police, for whatever, and so on. We must then come, there's a 6 months period that the minister has given us to say, go and look at this thing, because these are enablers to productivity of public servants. So you can't isolate the financial literacy issues to the healthcare literacy issues, because both have an impact on this individual. So whether you talk what they have prioritized or they have seen as prevalent diseases in GEMS, the unintended consequences of that is brought by some of these financial situations that public servants find themselves in. And some of them include even missing middle. Remember, we are not even addressing the issues of public servants who can't afford to take their kids to universities and so on and so on. So these are the things that at some point we'll see, because Cabinet also said, come back and brief us. And our minister was not well that time. Come back and brief us on some of these things and tell us how we are going to deal with this, including what the NSG has picked up during the skills audit. Because NSG did skills audit to say, why are we delivering shoddy work in government, whether it's roads, whether it's what, whether. And when they picked up those departments that they picked up with Human Science Research Council, they found that many departments that are infrastructure-led, many of those public servants are doing MBAs and other things and not focusing on enhancing themselves to do what they are employed to do. So they are looking beyond the department, but not improving the situation. So those are the things that we tabled to Cabinet, and we now have to see how we correct. So there's a lot that we can deal with, but I'm just saying, these are the systems that are in place, and that's why NSG is taking the route that it's taking, but we'll still have to come back to take you through some of those processes. Thank you.
Thank you very much. Minister?
Thank you very much, Chair and members. I do not have much to say because we're discussing with the DM here, so she has presented most of what I wanted to say. Safe to say that we apologize for the issue of financials. They will follow shortly. We'll see how we bridge that gap. But there's also something that's important, which was mentioned here, following or answering rather a specific question by a member, which speaks to so much amount of money that gets lost through fraud and corruption. But the APPs don't say anything about that, which I find it very strange because there's so much money that is getting lost. At the end of the day, members have to pay for that loss. I would have assumed that APP themselves will show that and as to how they will mitigate. But I think some of the matters we are going to address with GEMS in our own meeting, but there's a lot that needs to be what you call attended to in as far as the session for today's purpose is concerned. Thanks.
Chair.
Please go ahead.
No, Chair, it's not a question, Chair. For me, when the minister was making an introduction, he presented his health condition. If we don't mind, I would request that we excuse him in the next session if the members don't have a problem with that. We will give him an opportunity in the next session. Thank you, Chair.
Chair, am I that close to death?
No, in fact, we are giving Jesus Christ to deal with you in our absence as we are coming from the Easters.
Thank you, members. We've run gone quite a long time on our time. It's now 10 minutes to 1. Members, so we can do one or two things now. We can either push through on the agenda and have 2 presentations and deliberate, which will only take us to lunch in about an hour and a half. My suggestion would be that we break now, have a lunch, and then come back. Is there any objection to that? Okay. We will then now break. I would like to ask members to please be back at 1:30, so that in 40 minutes. I think that's a fair opportunity for everybody to grab something to eat. And we restart the meeting at 1:30. Thank you, everybody.
She's the GM.
Members, if we can settle down, please. Thank you, members, and all other attendees. I hope everybody is powered up and energized and ready for the second leg of our committee meeting today. Members, I've had a quick deliberation with yourselves, and it seems like all members, there's consensus that we are happy that we are going to do all three presentations and then have a deliberation at the end, unless there is an objection from any member. But if everybody is happy with that. And then there's also been, I understand, a request from the DPSI and the CPSI to swap over, to swap their slots on the program. Is that correct? Or not? Okay. Well, then let's move as per the agenda. Members, we are waiting for the screen to come on, but if I could just see if all members should have a hard copy of the CPSI presentation. Okay, I think then we are good to move if the presenter is happy to continue that way. Just give him a moment with the tech.
Okay, let me just. Thank you, Chair. We'll sort it out whilst we are.
Okay. It is a little bit ironic that it's the CPSI and the tech that's failing us.
I think it's just probably the technology. It normally happens like this. Thank you, Chair. My name is Piers Skoenraad, and I'm heading research and development at the CPSI. Our acting executive director is currently on leave, and therefore I'm filling her shoes. My feet are slightly larger, so I assume I'm overfilling her shoes. Thank you very much for this opportunity. I'm aware of the time constraints, and therefore I will take the presentation as read and just focus on the areas where we are doing things differently, what we have learned, and how we have aligned with the MTDP as such. Chair, but let me also just acknowledge the Minister in absentia and the Deputy Minister and honourable members and colleagues. The CPSI is the smallest in the portfolio, with a budget of about 50 million and a staff of almost 40 people. And our mandate is derived from the Public Service Act that makes the Minister responsible for innovation, and then specifically the operational notice that was published in 2011 that defines the kind of role that we should be playing in terms of entrenching a culture and practice of innovation. What we did during the development of the strategic plan, as members would have seen in the presentation, and I'm not going to go into detail, is we made sure that we consulted with our colleagues within the portfolio, with the PSC, as well as with academia in terms of the latest state of innovation in the public sector, and obviously received the inputs from the Deputy Minister and the Minister, and from colleagues in our national system of innovation, particularly also to deal with issues like intellectual intellectual property in the public sector. And we also then engaged with, through the normal processes with DPME and the AG to make sure that our APP and strat plan then align. I think for members, if I can go to slide number 7, where there is just a summary of how we then are endeavoring to fulfill the MTDP priorities in terms of supporting the building of a capable and ethical and developmental state. Institutional capability and innovation is obviously where we will feature most. And then also support evidence, policy making and data-driven decision making, as well as building of partnerships, because these things cannot be done in isolation. And one of the challenges that we do have in the public sector is the siloed nature of working, and that we need to optimize collaboration. Having said this, our work extend also into the other 2 priorities. As members would be aware that under priority 1 of inclusive growth, that's where the National System of Innovation features. And we work very closely with the National System of Innovation to make sure that the benefits that are derived from institutions like the CSIR, HSRC and NACI and NIPMO then translate to the work in the public sector. I think sometimes we forget that the public sector is almost 30% of this country's economy. And therefore, it's very important, if we want to see inclusive growth, that we need to make the public sector more innovative. We have done the mental shift in terms of capacitating SARS at the revenue side, but we have not made the shift in terms of optimizing the public sector in terms of on the expenditure side. And that is something that we would like to champion under the leadership of the Minister and the Deputy Minister going forward. Also in terms of reduction of poverty and the cost of living, the second priority, many of the solutions that are coming through our awards program addresses these. And therefore, specifically in the replication program that my colleague Glendani, who is sitting there at the back, Mr. Mtetwa, is leading, would also touch then on those. Chair, moving to slide number 8, it's just a summation of our mandate, our mission, vision, and the outcomes-driven approach that we have in terms of the culture of innovation as well as the value. I'm not going to stand still on those, as well as the next slide, which we previously presented to this portfolio in terms of how we actually apply the practice of innovation, in terms of moving from a needs-driven research approach up to the level of sharing and knowledge platforms that we are operating. The programs remain only 2 programs within the organization. As I've indicated, we are small. Our normal corporate services part, as well as our research and development, institutional support and replication, as well as enabling environment and stakeholder management, that are the delivery arm of the organization. In terms of slide number 10, the organizational structure. Honorable members will then see how we are designed in terms of the organizational structure. Perhaps just a side note on the organizational structure. As with any government department, you'll see this typical wedding cake structure that we have that cascades down, and that's one of the things that we are working hard in changing. The nature of the innovation of the organization, the nature of innovation is such that we need to work with teams, for example, teams of developers with different capacities. So we need to be a flatter structure in terms of how we deliver on projects and on initiatives. Moving forward to our overview of human resources, we were able to get some funding for within our compensation of employees. So our vacancies has increased, but that's to a sense a theoretical issue because the vacancies became available from the 1st of April. So we're obviously in the process of filling these posts, and therefore I think by our Q2 presentation to this portfolio committee, we will hopefully be able to tell you how far we have come. We're actually in the process of shortlisting and interviewing for 3 of these posts. So those should be concluded by the end of this quarter. It's very important for us to start building, and in the previous conversation and questions, we were talking about digital transformation, to build the skill set that can lead this engagement. And I think very important what the Minister said in his introductory part is that we need people that can play a catalytic role. We are too small to do all the innovation on behalf of the public sector, and therefore we need to play much more of a catalytic role going forward. I'm not going to go into detail in terms of the highlights from the previous 5 years. We've previously presented this to the Portfolio Committee, so I will just focus on the lessons that we have learned during these 5 years and what we want to do different or want to do more of. On the governance side, we have a proud record that we have received clean audits, I think 8 years in a row now. But a clean audit is only saying so much. It's just saying how we are managing the resources that we are. It's not talking to impact. And although I think it's important, as with NSG, we are in the investment side, so it's very difficult to sometimes talk about impact because the knock-on effect is much later felt within departments. But even though that is the case, we need to look more at outcomes and the achievement of these outcomes. On slide 14, one of the things that we are very proud of and that we believe we can assist departments is the 30-day payment, which we are now constantly keeping below 5 days on average, which means it is possible to pay suppliers. We've got a small supplier database. We need to acknowledge that, but it's about the internal processes of checks and balances that we've put in place to make sure once an invoice is received and once it's cleared that it is correct in all respects, that it is then paid very quickly, and that we have enhanced that invoice processing. And we're actually working with other departments, specifically with hospitals, in terms of bringing about the same kind of processes and approaches to this. And one of the key elements is digitizing the whole process. And that one, unfortunately, when it comes to the auditors still want to see those packs, and that's another battle that we will still fight in the future in terms of changing the way that we audit digital processes. Over the past period, there was 2 years that we didn't have 100% achievement, but we have since managed to bring that up. As I've indicated, I'm not going to talk to the specific lessons from the past or the specific projects from the past. We'll also have an opportunity on the 14th to present to the committee the projects that in much more detail that we are focusing on and collaborating on going forward. So we will go into more detail on these 2 slides on the 14th. But what we have learned over the 5 years was that we are actually, as an organization, not properly capacitated to do projects in an agile manner and move forward. So it does take us longer, and we also don't necessarily have all or can afford all the skill sets. For example, dealing with issues of cybersecurity is a very specialized skill set, and on one of our projects, trying to actually implement the correct cybersecurity and POPI compliance issues within that department was much more effort than we anticipated. Because of the lack of systems. The same issue in terms of the so-called digital divide. From our side, we have to see, we don't like to talk about the digital divide, we like to talk about inclusion, because we need to deal with the digital divide at the design stage. So to design a solution, for example, the Gauteng EMS, and one would think connectivity is not a problem in Gauteng, but some of the outlying clinics in a place like Orange Farm has serious connectivity issues. And therefore, as part of bringing in the solution, we had to solve the digital divide issues first. So it does take us longer, but it's not always negative, because we can then more fundamentally deal with the problems. We see so many of these solutions that are brought by external service providers. They run perfectly for a year, and then the contract ends, and then they become unusable. And what we are trying to do then is, and that's the different focus that we will have in the new 5-year plan, is that we design with the outcome in mind. And I think the principal of NSG has echoed the same kind of language in terms of how their programs are designed. And that is some of the underlying principles of using design thinking, which the NSG is then also propagating. We have seen amazing results around the replication. We have, despite many of the challenges, we have very creative public servants. And they are solving some of their problems, and sometimes they just need elevation and support for the replication of these solutions. And that's also something that we are going to do more of, and that is have a more targeted and catalytic approach, and a more of a portfolio approach to our work. NSG has also done masterclasses on mission-oriented innovation, which then propagates a portfolio approach. And this is what we will be doing, and what we will also present to this committee on the 14th. In terms of such an approach, you then look at a cluster of problems, because many of the problems are so-called wicked problems, which is incidentally also something that's in Nyokela that public servants need to learn about. So to deal with those wicked problems, you actually need more than one solution that can work together in terms of solving. So we will have a much more focused approach, because we do see from our previous interventions that we don't see the desired impact as yet. So taking projects that are focused on, for example, improving the HR environment in government, looking at 3 or 4 or 5 of these solutions, and making sure, working closely with the Minister and Deputy Minister, and obviously with the Policy Department, DPSA, to see how do we implement them, and see that we successfully implement them in these 5 years. And we will then obviously use our programs that we have highlighted. So in terms of the 5-year strategy, I'm just going to focus on the table on slide 21. Obviously, on the level of effective corporate governance, we will still pursue that we achieve unqualified audit opinions, but what we have added also was to deliberately report on internal processes that we are digitizing. And this is part of a bigger picture, and I just wanted to give honourable members that background as well. It's one thing for us to drive innovation in another department. but we need to practice what we are preaching. So as we are supporting departments, for example, in bringing in a digital performance management system, we need to implement it on our side as well and report on that implementation. So that's one of the things that we have brought into this strategic plan, and annually we will look at least, we've been conservative, but I will explain that later as well to members why we are conservative in our targeting. We expect that we will be doing more than this, but we have said that annually we at least want to digitize one process and make sure that it works, and that we sort all of the issues around the auditing of these processes as well, because we don't want to come back and say to this portfolio committee that we have digitized this process, but 20 departments now have problems with the AG in terms of the auditing of this process. So we need to make sure that all the steps are taken. In terms of Program 2, the culture and practice of innovation, we will continue to enable those innovation processes. Some of these will be projects that we developed from scratch, but we will do less of these. Most of them will be in-house developed digital solutions that we already have as a public sector, and that will be our focus. That we support the further development of these, and then the implementation and the replication of these. We just want to emphasize that not all innovation is digital. And not all digital transformation projects are innovation projects. And therefore, there will always be those sectors where some of the innovations will be not technology-driven. They may be human-driven, and those are the most important ones. So our replication program and our awards program will continue to elevate these as well. So we will focus on at least for R&D projects, as well as then towards the outer years, more replication projects. And what we will make sure of as part of the work is that these are then aligned very clearly with the MTDP in terms of our selection. Moving then to the APP on slide 23, that looks very much similar to the deliverables over the medium term, and that is just simply then, as I've indicated, that we look at the internal workflows that are being digitized, and on slide 25 we look at the number of innovation solutions replicated. We will continue with our knowledge platforms and to sustain these, and these are mainly training workshops that we conduct, and I'll give just an explanation where it's different from what NSG is doing, and our awards program where we unearth these solutions, as well as our annual conference. In terms of the training workshops, what we try to do is introduce new methods, new approaches. One example was design thinking, and then collaborating with NSG. This is now an offering of NSG. When we presented our strategic plan 5 years ago, and when NSG presented their strategic plan 5 years ago, nobody used the word generative AI. Nobody used the word prompt engineering. So over the next 5 years, we anticipate that there will be numerous new skills and approaches that will arise. So we will use these workshops to introduce the concept to public servants, and then work closely with NSG to then offer this, if successful, as an offering within for the broader public sector. We have worked on 3 courses already, and I think that's something that we will strengthen as well. Also, in terms of, maybe just to make the other connection to the GEMS presentation, many of the projects that we are replicating within the health sector are supported by GEMS through the GEMS award that is awarded at our awards program. So it gives a bit of seed funding for us to take that solution then to the next hospital, and we hope that over the next 5 years we can continue working with GEMS and other partners to provide the seed funding for replication. So we will continue the number of solutions replicated, and then what we've added as well to the program of institutional support and replication is the actual institutional support, where we need to build capacity, because many institutions need hand-holding for them to actually implement these innovations, and we will focus and report more specifically on these. Chair, in terms of the budget, slide 26, I've indicated that we will move from about 50 million up to 55 million. This is not sufficient to do our job, but we have taken the approach where we will be working more catalytically, and where we will engage with yourselves then on the 14th to show you how we are doing it. Maybe just to give you an indication is that we are part of a interprovincial network of systems developers, of systems architects, where we learn from each other, support each other, and share capacity. So, for example, one of the long-term projects that we are reporting here in terms of virtualizing to Song Service Center services. The Western Cape has taken responsibility for the further development of the solution in partnership with the Northern Cape and Eastern Cape, and therefore we use internal government resources to actually develop the system, and we believe that that will be have a huge impact on citizens' access to service delivery. We, for example, know that there are 4 performance management systems that have been developed by public servants themselves. So we will engage and take the best and share the source code of these and then replicate that across the public sector. We have 2 or 3 e-recruitment systems that would not cost the public service a cent to replicate. And this is what I mean with catalytic work, because the systems are there or under development, and we need to just take it further. On the 14th, we'll bring the developer from the Eastern Cape of one of these systems to come and demonstrate to you how this is being done. And the list goes on. We have a myriad of solutions, but these are because of the siloed way that we are working. And our focus is going to be in the next 5 years to take these and to then engage with the support and with the guidance, and sometimes we hope with the intervention of the Minister and the Deputy Minister, so that we can implement this across the public sector. And this is how we will spend that 50 to 55 million going forward. We are making sure that we are building internal capacity. So our goods and services budget is getting smaller, and it should be getting smaller if we are promoting internally developed solutions, because we don't have to then pay external service providers. And therefore we can slowly build that capacity within the public sector. Honourable Chair, that brings me to the end of the presentation, and my sincere apology that the CPSI couldn't get the technology working. I think the 2 laptop and the system didn't want to match, but I'm sure that DPSA will have a presentation again. Thank you, Chair.
Thank you very much for that presentation. We will just give a moment for DPSA to set up. Ah, there we go. It's you, it's not us. Welcome, members of the DPSA. Please proceed with your presentation. Thank you.
Thank you very much, Honorable Chair, Honorable members, Minister, His Absentia, DM. Thank you very much, and my colleagues. My name is Willie Vukela. I'm the acting DG for the department. We're gonna share with you our APP and our 5 years in terms of the MDTP. I think one of the issues covered by the Minister in his intro this morning, our presentation is in threefold. I'll give you the first slides on the background, constitutional legislative mandate, and therefore high-level structure and overview. And my colleague DDG Linda will cover the overview 2025, and then CFO will cover financials. Colleagues, members, in terms of constitutional mandate, in terms of the Public Service Act, the Minister of the MPSA is responsible for establishing norms and standards. These are critical issues, norms and standards. That's the key mandate of the department. It's a policy issues. Now, those covers the function of the public service, how the public service must function is guided by the norms and standards issued and developed by the DPSA. We do the issue of structures of other departments. Wherever department want to issue structures, they consult the DPSA for concurrence because we look at modalities, how government is configured. The issue of condition of service, your salaries, your health issues, GEMS was here. So we define in terms of the condition of service, which are underpinned by labor relations matters through our resolutions, negotiations, and otherwise. And therefore, information management, your IT minister is the one who issued directives and determinations on how ICT must be used in the government services. That's part of digitization of public service. That's his role covered by the issue of normal standards. Electronic government is e-government part of the IT, and integrity and ethics, which are the key roles in terms of how government must behave. I think the morning through NSG have delved much on the issue of ethics, the conduct, the behavior of public servants. So the role of the minister is to guide in terms of norms and standards on issues of ethics. Transformation is a key issue, Honorable Chair. We are now in the 7th administration, the GNU. Our focus is how look at how government is configured and transformation of public service for the better of service delivery, which is our key mandate. Now, secondly, we look at second legislation, which is the PAMA, that seeks to promote the values and principles contained in Section 195 of the Constitution in terms of the applications thereof. In that regards, one of the key issues here is to provide employees mobility between a different sphere of government in terms of movement from all spheres. We know that they're all independent and they're interlinked in terms of their operations. And the issue of provision of employees and special advisors from doing business with the state. I think you've covered the issue with issue of the NSG chair in terms of how corruption is eating in terms of affecting the performance of the state. So from our role is to ensure that public servants do disclose in terms of their assets, which are able to determine the level of corruption, and therefore deal the issue of how we address the issue of ethics, which we establish as part of the instruments to measure in that regard. One of the key issues that the PAMA provide, Chair, is the establishment and operations of the office called Office of Compliance Standard, OSC. That office will do the issue of M&E and comply with the entire public service. As soon as if the office there is part of the DPSA structure, is incubated, but with a view that as soon as begin to operate functionally and effectively, it can become, if that's the wish of government, to become an entity. We can, at high level, Chair, just to provide a vision in terms of what DPSA stands for, you know, a professional, productive, responsive public service and administration, because our mandate is quite broad. We cover public service and public administration in that regard. The mission, we do the issue of norms and standards, as I've indicated, that we established for public service functions optimally, which is the key driver, by the way, our concern in terms of our operations. Our main operation is to ensure that government functions effectively. We provide some interventions. If you look when Linda present here, most of all our programs and projects is to intervene for government to operate effectively. We implement interventions to maintain compliance and how government can function in that regard. The PAMA will give us a leeway to do the issue of the other sphere of government, which is local government, by the way. National and provincial government, we are quite certain. We have done a lot of investment, we have done a lot of work, but we need to delve much into the third sphere, which is the local government sphere in that regard. And it will contribute towards how to improve public administrations in Africa internationally. We partner with a number of institutions, your academia, other government departments, your institution, from the AU instruments, UN instruments. We do harmonize and domesticate those that a country are signatory, like a public service charter is one of the instruments that we've signed off as an AU declaration. At high level, Chair, this is our organizational structure. You can see there are quite few acting capacity there. As I've indicated, Minister now is on the drive in trying to make sure that there's permanency. I'm acting DG. I've got Linda, who's DDG administration. This is the internal DPSA. Their role looks internal DPSA. And the rest of the DDG are external DPSA. Their operation is outward looking, all of them. The second one is acting DDG, Dr. Anusha, for human resources management, issues of skills, sit there, issues of training, issues of HR conditions, sit there, is outward looking. The third DDG, acting DDG, Dumisani Trope, is negotiations and labor relations. Issues of negotiations, engaging the labor caucus, our social partners, that is the key responsibility for that branch. Issue of structures, organizational design of department, NMOC, which is running right now for this GNU. We have collapsed other departments, we've created other departments, so that's a responsibility that we are working on right now. The next DDG is DDG Mandla, who do the issue of e-government and information technology, issues of digitization, e-government, information, data management, is sit in that portfolio. The last acting DDG, Dr. Sokela, who do the issue of government service access. This is the branch that takes the department of the minister to the grassroots to interface with citizens, issues of outreach, DDM, which the president is championing, they sit there. So that is the high-level structure of the department, Chair. Now, on the issue of background, as I've indicated, there are instruments that have guided our APP. In the center of the development NDP, is our policy position NDP 2011 document that envision a number of things, precisely chapter 13, that cover the public service, the form and shape, and addresses a number of issues, uneven skills, uneven service delivery, youth unemployment. Those issues are covered in chapter 13, professionalization. So this is where we draw a mandate. One of the key levers is the State of the Nation Address. The President has spoken in the State of the Nation Address for 80% on issues of reforms and digitization of the public service, where we are able to dwell in and begin to provide our issues. The MDDP is a driver now for government documents that have allowed to ensure that we align our APP with the MDDP interventions in that regard. Ministerial priorities. The minister spoke a number of issues that must inform his administration and have infused his priorities in terms of what will be done. His focus is on the cold phase, is that on the last mile, the last value chain of service delivery. When you talk about professionalization, don't just talk about your qualifications. Ensure that the value chain, you map it through, and to the end, where service delivery matters most, which is the key for this administration to change the scenario, to have an impact on what we are doing, can able to impact in that regard. I think honorable member asked the same question when when asking NSG and GEMS, the issue of the impact and change, the behavioral patterns of public servants in the cold fields of delivery. That's one of the key drivers that we do. And the DPSA policy priorities that we have, the amendment that we put through, that trying to address those issues that we've realized. Now, Chair, in your intro, you talk about the three key levers of this administration, and our focus in terms of the role of the DPSA on priority number 3, which we do infuse on the first and the second, but our key driver is to look at how do we build a capable state, which have got ethical employees, which are developmental in nature, to ensure that this government, at least the trajectory, move to the second layer of service delivery. That's our focus, because the issue must be able to measure impact on how we conduct ourselves as public servants, driven by the mandate that we drive from priority number 3. So, on the DPSA priority, Chair and honorable members, we've just given you some few areas there that are part of our commitments. One is to improve trust in government, which is a very big challenge. How to improve trust between the employees, government employees, and the citizens. I normally give a simple example, Chair. If you go to other countries, like Western Europe, you are wearing your name tag. You happen to forget your name tag, you walk in the mall, like you are Sweden. People see your name tag with public service, they salute you. They salute you. In South Africa, if you happen to forget your name tag, you are in the mall walking, know that you must run very fast. Because people see somebody who's stealing their money. You see the difference that I'm giving to. So we want to drive trust. Citizens must begin to trust employees. How do we do that? There are a number of programs, Chair and members, that we want to roll them out to ensure that public service become ethical. We respect the rands and cents that we receive as part of service delivery in that regard. We deal with improving discipline management, the consequence management. In public service, employees hop from one discipline to another. You get fired from national department, tomorrow emerge as an MM in local government. Because our system don't talk to each other. You fire somebody today, next month you are an employee in local government. The same country called South Africa. So how do we ensure that our system interface? We've got a program to do that. Ensure that the lifestyle audit begin to show who are we as public servants. I think DM raised the issue of some of the things which are health and wellness with GEMS that are trying to do to ensure that public service, indebted as they are, there may be some relief that government can put a program together, like a housing scheme, medical scheme, and other scheme that can assist these public servants to change, to modernize self-delivery monitoring system. Modernize, Pierre was here, my colleague from CPSI says, innovation may not be digital, but how do we modernize to remove the fats? Why it has to take so long to apply for a license, for example, to apply for an ID, for example? Home Affairs have done so well. They've removed all the fats. You apply for an ID within a week, you receive it. Initially, to take you 6 to 12 months, we do that. We modernize self-delivery intervention in the entire government system as a key driver, and strengthen our collective bargaining processes. How do we engage our social partners? Not to wait for negotiations on the wage increment. No. We must dialogue, because labor caucus, social partners have got employees which are there, members which are employees. So every time we must find space where we interface and engage with local government to increase productivity for the public service. Again, as I've indicated, to the left, the MDDP indicators that the DPS is leading on. There are areas that DPS take a lead through the minister. There are others that ministers support other ministers. For example, on ethical and capable state, the DPSA is leading. There are many departments that support. Your Justice Department, your SIU, your SAPs, that support, but we take a lead. We do the full implementation of the framework on the professionalization of the public sector. The broader public sector it is, but we look at public service, which confines our role. And we've put some targets that we want to achieve, like 100% appointment of accounting authorities. We talk about the DGs, HODs, where you allow, for example, a separate structure to run the process. The issue of compensation below 30% of consolidated expenditure, 50% of selected departments for service delivery, all those things that we have to address falls within the issue of ethical where we're leading. Secondly, we deal with the issue of how do we address the principles, how do we institutionalize the cultural values and principles run by the PSC as our commission. Our role, there are a number of programs, like we are about to build programs, that addresses the behavioral patterns of public servants in that regard. So, Chair, let me pause here and allow my colleague Linda to take us through 2025 to 2030. Thank you very much, DDG.
Thanks, Acting DG. Good afternoon, Chair, honorable members, DM, and Minister in absentia. In the interest of time, Chair, I think I might just spend a little bit more time on the 5-year strategic plan targets rather than the APP targets, because the 5-year targets will be broken down into this year's APP and the subsequent APPs after that. So I think, as indicated by the acting DG, before the members ask why all our indicators are talking about monitoring, I think it's important to contextualize that in the previous slide that the acting DG spoke to, those are how the indicators are actually crafted in the MTDP. However, what we've indicated is that we've had to, with the agreement of the DPME, to craft them slightly differently so that they fall within the mandate of DPSA, which is policy development, or what is known as norms and standards, but focusing on monitoring as part of the work that we'll be doing for the next 5 years, because the majority of these indicators were also implemented under the 6th administration. But the intention now is to look at intensive monitoring so that we can assess the policy impact that we would be that we want to see in the public service to ensure that the norms and standards or policies that we've issued over the past 5 years are really creating the required enabling environment for the public service and administration to function optimally. So with respect to the work under the Public Service Human Resource and Management, we'll be looking at ongoing monitoring of the national framework towards the professionalization of the public sector. In the past 5 years, whilst the framework, after the framework was approved, there's been a lot of work that has been done in looking at the institutionalization within the public service. And to this end, the DPSA has issued what is called Volume 1 Directive, which takes some of the work under the different pillars of the framework and direct departments to implement those. So over the next 5 years, we'll be issuing such directives and monitoring the implementation thereof. The MTDP has also raised a concern about the tenure of the Public Service Directors General. And a study that was done a few years ago showed that DGs stay an average of about 2.7 in their posts. And when we talk about the National Development Plan that talks about stability, amongst other things, in public administration, that research was informed by the findings of the work that preceded the development of the NDP. So the intention is therefore to track the trends in the tenure and to identify whatever would be the factors and dynamics that are leading to DGs not staying the full 5 years, so that Cabinet can be advised accordingly on what interventions need to be put in place. Similarly, within the professionalization context, we will be monitoring the trends in the appointments of Directors General that meet the requirements, the legislated qualifications and experience for those posts. As part of the work that the Minister does, we do quality checking of the appointments of Directors General for the Cabinet process, where our Minister then goes and presents those appointments. So as part of that work, we'll then be monitoring and reporting to Cabinet whether the DGs that are being appointed are meeting the legislated qualifications. There will be ongoing work on the implementation of the national framework towards the professionalization, as I've indicated, as well as the implementation of the skills audit with the intention of reducing the skills gaps that have been identified. I think in the morning when the NSG presented, there were also reference made to the skills audit. So as part of that work, the DPSA will be supporting departments to conduct those skills audits. The NTDP has a specific target where they want to actually see by the end of the 5 years a reduction in the skills gaps that would have been identified through the skills audit processes. Under the negotiations and labor relations, as Deputy Minister, I think, indicated earlier on, that over and above negotiating on wages, the collective bargaining processes also negotiates on other conditions of service, whether it's leave, your medical aid contribution, the housing scheme, and all of that. So this work will be ongoing over the next 5 years, even though we've just concluded a 3-year wage agreement with labor. So during this 5-year period again, this 3-year agreement will come to an end, and the negotiations for the next, hopefully for another 3-year agreement will also ensue. The personal expenditure review was a study that was conducted a few years ago and presented to Cabinet on the remuneration and other conditions of service of public servants. And Cabinet approved the recommendations, and part of the work that the DPSA is required to do over the next 5 years is to implement specific recommendations. For DPSA, that will be the development of the remuneration policy for the public service, but we'll also be monitoring the implementation of the other recommendations that will be implemented by the sector departments of health, social development, correctional service, public works, as well as justice and constitutional development. The acting DG spoke quite a bit about the work that we'll be doing on ethics, integrity, and discipline management. The committee is familiar now with the reports that we've been bringing on the reduction of disciplinary case backlogs and the long suspensions. So this work is going to continue. But I think the focus now going forward is to also ensure where there is issues of unethical behavior that has been unearthed through the conducting of the monitoring case backlogs or the implementation of the lifestyle audits. The emphasis will be making sure that the required consequence management is being implemented. So the monitoring that we'll be doing over the next 5 years would be a bit different from what we've been doing previously, where we were just checking that departments are complying with the conducting of the skills or of the lifestyle audits to actually tracking where there is consequence management if departments are implementing those accordingly. A new project that started last year was the development of the central register. The acting DG spoke about the purpose thereof, and it's going to be used mainly in the recruitment processes because sometimes public servants do not declare that they either have been dismissed or they are facing disciplinary cases. It is legislated that there's certain exclusionary periods that are legislated in the Public Service Act and regulations, that if you have been dismissed for certain types of misconduct, you can't re-enter the public service, depending on the nature of that misconduct. And I think it ranges between 2 and 5 years where you cannot come back. But because sometimes, especially when public servants move across the 3 spheres, it's very easy for one person to be fired today in a national department but be employed next month in local government. So the intention of the register is that you should be able to track the movements of public servants within public service, which is national and provincial, and ultimately across the public sector, which also will include local government. I think this is the duplication. With respect to issues of public service and for ICT, the main activities that will be done over the next 5 years will be focusing on monitoring the implementation of the various ICT norms and standards that have been issued to date. And this work will be done within the context of fast-tracking the digital transformation of the public service for improved service delivery. So it might look like a very small priority, but the indicator, but there is a number of ICT norms and standards that will be monitored, selected ones over the next 5 years. And then the last program, Chair, is the one that looks at service delivery access. This is an MTDP target where we are required to track the productivity of selected service delivery and economic development departments. This is work that the DPSA has been doing over the past 3 to 5 years, and we will continue monitoring the rest of the departments that we are working with, but specifically for the MTDP, the focus is on service delivery and economic departments, with the intention that they will achieve at least 80% of the productive measurement indicators. There are 3 key indicators that have sub-indicators, so the monitoring is done against those, and we will then be tracking. The intention is that once departments have conducted their productivity measurements, they develop action plans, and then they implement those action plans with the intention that their productivity levels would improve as a result of the successful implementation of the plans. The work on the Batupili strategy implementation will continue. I think, as the acting DG said, it's one of the priorities that Minister has requested the department to implement. And the intention is more around the inclusion of citizens in the delivery of services. Therefore, in addition to, or as part of the Batupili strategy, will also be reviewing and over the next 4 years, tracking the implementation of the public service complaints and compliments framework. Currently, every department is supposed to have this in place, and the departments are required to then deal with the complaints and compliments from citizens and use those to improve how they are delivering services. And it's one of the work that I think the acting DG spoke about getting the work of the public service closer to citizens. And there will be a lot of involvement thereon by the Minister and Deputy Minister in terms of implementing this specific program. We were peer-reviewed as a country as part of the second generation under the peer review mechanism. There was a national action plan that was approved by Cabinet. So the DPSA will then be tracking the implementation of that action plan in preparation for the next country peer review. The work on the Office of Standards, which was brought into operation by the PAMA Act, the office is specifically put in place to assess, one, compliance to the norms and standards that have been issued by the minister, and secondly, for evaluating the appropriateness of the norms and standards that are issued by the minister, and to advise minister on the interventions that he needs to implement in departments. So minister has indicated that we need to step up on how we enforce compliance. So part of the work that a minister will be doing over the next 5 years is also bringing those reports where there is non-compliance by other executive authorities as part of Section 16A of the Public Service Act. So over the next 5 years, the office will be selecting specific norms and standards that they will be monitoring compliance to, but also evaluating the appropriateness, so that the DPSA can be able to go back and review their norms and standards to ensure that they are responding to the changing needs of the public service, so that the policies that we develop really create the enabling environment. The last priorities, Chair, that I will speak to is the internally facing DPSA. And we've selected a few. One is coming from the MTDP, where we are required to monitor the appointment of women into SMS positions, as well as people with disabilities and youth. So the government target for women is 50%. We have increased ours internally to 60%. And we've also increased the target for the appointment of persons with disabilities from 2% to 3%, which is a percentage above the government target. And then for youth, it remains at 30%. I think what I can mention here is that we've also approved affirmative action measures in the department, so that we are able to create an environment for us to be able to appoint women and persons with disabilities. We have similar measures where if the second candidate that is nominated for appointment is a woman or a person with disability, and if the score difference between the first candidate and the second candidate is 5 or less, then the department will appoint the woman or the person with a disability. Under the CFO, as legislated by National Treasury prescripts, we will be submitting quarterly reports on fruitless, wasteful, and irregular expenditure, as well as assessing our status of compliance with the BBBEE prescripts. Lastly, Chair, I think it's important to indicate, because we've had a question asked by the committee before, that what happens after we have identified fruitless and wasteful or irregular expenditure. It is usually, the report will go to the accounting officer or the director general, and our internal audit will then investigate, and where there is consequence management, it will be implemented, or if there is write-offs, the National Treasury processes will then be followed accordingly. Chair, I think I should end it here, because if I go to the APP, it will basically be a repetition of the same thing. So through you, I will hand over to the CFO, who has just yanked the laptop. I hope it didn't disconnect. Thank you, Chair.
Thanks, Linda. Afternoon, Honorable Chair and Honorable Members. Just quickly, I'm just going to take Honorable Members on the budget allocation for the department over the MTF. I'm not going to go through all the slides, but some of the slides just repetition of information. With the slide number 31, what we are actually indicating, we're indicating the budget allocation over the 3 years
period 2025 to 2027-28 financial year. We are indicating, honorable members, the split of the budget per programs, the 5 programs that we have talked to on the APP, starting with program 1 up to program 5, which is government services access and improvement. The total budget for DPSA alone for this financial year that has just started is 511,733,000, and it goes up to 560 million over the MTF. If we include CPSI, because CPSI in terms of the vote, they are included as part of the our vote in terms of the allocation. We do the so-called transfer payments on a monthly basis to them. They have already indicated their plan. It's 50 million in the first year, and in the outer year it's 54 million that is budgeted for. All in all, the DPSA budget vote allocation is 561 million. 804 in the first year, and 615 million in the outer year. The next slide, what we're indicating, if you would have seen in the previous slide, that administration takes about 294 million of the budget and 325 in the outer year. The pie chart here indicates the percentage in terms of how it's distributed amongst the programs. 52% goes to administration, and it's because this is the support branch which supports the work of the DPSA. That's where you get your legal services, IT, corporate services, HR, finance, and ministry also. It falls under the administration to support the work of the DPSA. 19% of the budget goes to government services access improvement, and 15% of the budget goes to the third branch, which is negotiation, labor relations, and remuneration management, and 10% and 4% goes to HRM&D, which is human resource management and development, and e-government services respectively. If we go to slide number 13, that's where we're indicating this budget split in terms of the line items. Compensation of employees over the MTF, the first year is 305 million, and in the outer year is 333 million, which composes of 54% of the budget of the DPSA. The reason is that we are a labor-intensive department. We don't have budget for consultancy work. We rely on our employees to do the work, because as a policy department, it's actually viable that our budget will basically exceed the 50% mark, because we rely mostly on our own internal employees to develop policies and do the work that is on both on the strategic plan and the APP. The 35% of the budget goes to goods and services, which is 194 in the first year and 213 million in the outer year. Our main cost drivers is IT services, it's traveling, as well as the office building. Those are some of the main cost drivers in the department. Transfer payments takes 10% of the budget, which is 56 million in the first year and 61 million in the outer year. From that 56 million, 50 million goes to CPSI, and 6 million is basically the leave graduate that we pay to those who are going on retirement or those who resign. That would be applicable also in the middle year as well in the outer year. And only 1% of the budget will go to payment of capital assets. That's basically just to buy some office equipment like your laptops to assist the department to function. Chairperson, I'm not going to go through the next 5 slides. This I'm just indicating the same information that I have indicated in this slide. But this now we've just split it into components. Like program 1, those are the components that belong to program 1, as I indicated: ministry, corporate services, finance, legal services, and that is the budget allocated. The same in program 2, we indicating the units, and the information is still the same. Program 3, which is negotiations, labor relations, that's the same information. We're just indicating how we have split then the budget amongst the different components under that branch to assist the work that we've just indicated. Program 4 as well as program 5. Chairperson, let me stop here. Thank you.
Thank you very much to the DPSA for the presentation. We then move on to the PSC. I believe we've got the Deputy Chair and the Western Cape Commissioner here. Welcome. Just give you a moment to set up.
So good afternoon, Honourable Chairperson, Honourable Deputy Minister, Honourable Minister in absentia, Honourable Advisor of the Minister, and members of the Portfolio Committee. My name is Zuki Swam Kolomba. I'm the acting chairperson who's leading the delegation of the PSC in presenting our STIR plan for the next 5 years and our APP. Before we start, we'd like to submit an apology on behalf of the chairperson, Fikenisa Madoda, who has taken leave because of family commitments, as well as the Director General, Dingi Dube, who has also taken leave because of family responsibility. And that is why I am leading this delegation as the acting chairperson. And this is why acting DG Sejibe, Kolofelo Sejibe, is acting on behalf of the Director General, Dingi Dube. But it brings us a great pleasure to be here today, and we'd like to thank the Portfolio Committee for the invitation to present our STIR plan and the APP. Ours is to make sure that we promote an effective and efficient administration, and we contribute towards the development of a developmental, capable, ethical state, which is also transformative, professional, and responsive. I'm not going to take long because we are fully aware that we have 30 minutes between myself and the last presenter. But I would like to introduce my team. Firstly, Commissioner Seal, who's the resident commissioner for the Western Cape. He's sitting over there at the end. He'll also be answering the difficult questions that I am not able to answer to this Portfolio Committee. I'd also like to introduce Acting DG, Kolofelo Sejibe, Dr. Acting Kolofelo Sejibe. I'd like to introduce Chief Director, Sia Koyise, as well as our CFO, Mr. Momeka, who's sitting on that side. Thank you very much to the chairperson and the Portfolio Committee, I will now hand over to Acting DG Sejibe to present our STIR plan and APP to the Portfolio Committee. Thank you very much.
Good afternoon, Chairperson, Commissioners, members of the Portfolio Committee, and all colleagues. I will be sharing this presentation with our CFO, Mr. Momeka. Let me recognize our Deputy Minister for continuously supporting us and getting us ready for these committees. Our presentation is going to be very brief, so I will assume that it has been read in a number of areas. I'm just going to highlight what is important, and I will skip through. We will be talking very briefly about our mandate and strategic focus, the program outcomes and performance indicators, as well as the budget outcome. Members, that is just our commissioners. I know some have been to this particular office, but I'm happy to indicate that most of the members have seen them when you came to see the PSC now in March. And this is our executive committee. Again, they have been introduced to the committee before. Let's proceed and just indicate that in terms of our mandate, Section 196 outlines our mandate as well as our powers and functions. But most importantly, it is to indicate that the PSC is expected to do its work without fear, favor, or prejudice in the interest of maintaining an effective and efficient public administration. And in that regard, public administration covers all spheres of government and state organs in terms of Section 195 of the Constitution. Therefore, members, the PSC takes the issue of impartiality absolutely important, and it is expected, as outlined in the Constitution, that all organs of the state may not interfere with the powers and functions of the PSC, and they will all do everything in their powers to support the PSC to perform its duties. If we proceed with the presentation, members, we would like to indicate that the PSC bill, which is currently before the NCOP, clearly provides for the creation of a secretariat instead of an office of the PSC that is listed as a department in Schedule 1 of the Public Service Act. There are pros and cons, and I think these are clearly outlined in the business case that informed the review of the PSC bill. But most importantly, the bill enables the PSC to be able to extend its functions and operations in the sphere of local government and state-owned entities in a manner that is properly legislated. We are therefore looking forward to the enactment of the bill, and we would like to appreciate the support of the committee in taking the bill to where it is at this present moment. The next slide, members, simply illustrates that the PSC indeed appreciates the support of this committee, but also the oversight of this committee over the responsibilities of the PSC. We are an oversight institution. However, we also appreciate oversight from important structures such as the portfolio committees and legislatures. Members of the committee, our vision is very, very clear. We are an impartial and innovative champion of public administration excellence in South Africa, or we aspire to be one. A vision is a very difficult thing that you can say, I have reached the destination. You continuously pursue your vision and seek to perfect it. Our values and principles, we like to summarize them briefly as pre-fair. If you look at the first word of each and every one of the letter, it says pre-fair. Unfortunately, we could not say pro-fair, but that is in line with our mandate that says we need to perform our duties in a manner that is fair and impartial. And we achieve this by promoting the constitutional values and principles, as well as service excellence. Members, we just want to indicate that promoting the constitutional values and principles is not an end in itself. If it cannot assist us in realizing a citizen-centered a capable, ethical, innovative, and developmental state, we would not have achieved what we need to achieve. The CVPs need to speak to the soul and the character of a public servant. In terms of our strategic overview, I will not go through into the details, but we would like to indicate that the work that the PSC does is largely informed by key strategic documents in government. It is also informed by ongoing public service reforms, such as the professionalization of the public service. It is also informed by the MTDP. But alongside all of those issues, we need to try to make a contribution towards an effective and efficient public service through networking and collaborating with various stakeholders who are operating within the spaces that we operate in. It is for this reason, members, that our strategic focus areas for the next 5 years, we will be placing a lot of emphasis on issues of a professionalized public sector and improved state capacity and capability. This is in line with the MTDP Priority 3. And let us indicate that the next strategic focus area, which is improved service delivery, is also core to the MTDP priorities. We regard Priority 3 of the MTDP as a means towards the realization of MTDP 1 and 2. If we can indeed have a professional, capable, ethical public service, we should be able to move towards inclusive economic growth. We should be able to deal with issues of social cohesion, service delivery, and everything else that is encapsulated in the 3 MTDP priorities. It is for this reason that whilst our primary focus is in MTDP priority number 3, we operate within the context of the integrated nature and the overlapping reinforcement of those 3 priorities. In terms of our strategic focus areas, the contextual background, again, as indicated by the previous presenters from DPSA and CPSI, it is the NDP, it is the GNU, and obviously the priorities that have emerged from the national government, the government of national unity. It is the shifting economic global eco-political space. Parts of this will be touched on by the CFO. And then it is the double VUCA moments, which we refer to as the era of volatility, uncertainty, complexity, and ambiguity that requires another VUCA, which is a vision, understanding, clarity, and agility amongst public servants. Within all of these things, we definitely, as indicated by the DPSA, supports the pursuit of professionalization because within a professionalized public service, there are many other values that constitutes what we call a professional public service. So the word professional is a highly loaded word that needs to be treated with the heaviness that comes with being called a professional. It is for this reason, members, that we also respond to the call for PSC's mandate to be strengthened. But we must admit, members, that the PSC's operations within the space of local government and SOEs, it is not going to be a PSC that hits the ground running. The PSC will need to take time to learn the structures, the systems, the successes, the challenges, and the stakeholders who are operating within the local government space. But as we learn, members, we believe that we can begin to promote the constitutional values and principles which we believe every organ of the state, irrespective of differences in our mandates, we all have a common starting point, which is the values that are outlined in the preamble, Chapter 2 of the Constitution, and many other chapters of the Constitution when we are looking at the IGR and the various sections of the Constitution where the Bill of Rights tends to be unpacked. We therefore think that the promotion of the CVPs marks the beginning of work that we can begin to do in local government and SOEs whilst we are taking time to learn the intricacies and the complexities of these sectors. So for us members, learning and development whilst we begin to learn to walk before we can run in the local government sphere is absolutely important, and it is in line with what has been supported in the PSC bill that says the PSC will not go on a big bang approach when we go into local government and SOEs, but we need to be gradual in selecting those particular areas that will enable us to phase in areas where PSC can begin to make a minimum contribution given our limited resources at this point. In the next slide, we are not going to talk to that, but it just demonstrates, members, that there is indeed collaboration between PSC and the Chapter 9 constitutional bodies. And in the next slide, these are our APP targets. We are not going to explain them in detail, but we just want to indicate, members, that the targets in Program 1, they represent what are compliance requirements from all government departments. We have, however, reworded the vacancy rate indicator because we can only be judged on the basis of posts that are funded. Our structure is a little bit bigger. It has not been fully funded for many years, so our vacancy rate tends to be high. Hence, we had to request that the articulation should be 10% based on the funded posts, not on the approved establishment. I think in terms of the other indicators, the 30-day payments, the percentage for triple BEE, these remain the commitments of the PSC to achieve 100%, but to also to seek to increase the triple B percentage to 70% over the 5-year period. And in terms of media and communications from the PSC, this is an important aspect of our work that I think for many years it was overlooked within the PSC. Hence, there were views that PSC does not communicate its achievements, nor do we communicate our observations about challenges and successes in the public service. So we are placing quite a lot of emphasis in media and communication. In the next slide, we simply want to indicate that we are not a PSC that is sitting in the office. We are on the ground, but we can do more of that work if we are properly funded. In Program 2, members, these are some of the key activities that we will be delivering on in terms of the APP. Again, one of the issues that we would like to highlight to members is 2.5. The reports look like they are few, but this is part of the area where we will be doing part of the work as learning and beginning to develop products that would assist the local government sphere. But we balance the reduction of a number of reports with 2.6, which is where we are ramping up the advocacy and engagements. Members, the advocacy and engagements for us as the PSC, again, is one of those important areas that for many years was overlooked by the PSC. If you go into our websites and you probably check 2014 backwards, you will see that PSC was churning out a lot of reports. But the reports were not necessarily read, they were not advocated for, we were not doing much to educate public servants about these reports and their findings and recommendations. And I think at the present moment, we are placing a lot of emphasis on advocacy because this is the way in which we can promote information sharing amongst departments, information sharing from the public service to departments and vice versa. This is the only way in which we can promote compliance with prescripts, ethical conduct, innovation, professionalization, and service delivery. it is through these platforms that we seek to make sure that a lot of the information that is lying around in bulky reports begins to be internalized by public servants in order to influence what we do daily. The next slide again, members, it simply indicates that we are out there, we try the best we can in spite of limited resources. Then we are in program 3, which is our monitoring and evaluation. In this particular area, members, item 3.1 in particular, this is where we are pushing with a lot what we call the flagship major projects on ICT and office accommodation, working with DPWI. These are 2 projects that we believe that if we deliver them very well and there is implementation of the recommendations and the outcomes that emanate from this area, we will be making the greatest of impact in the public service, not just in terms of addressing challenges that are confronting a DPWI in terms of the use of assets or state resources, as well as CETA in terms of ICT, but we will also be contributing towards effectiveness and efficiency, and maybe go to the extent of getting government to find ways of releasing some of the assets for use into other purposes instead of white elephants. Then we would like to go to item 3.4, which is the production of what we call the CVP evaluation reports. This is important. It is linked with what we refer to as the data warehouse that PSC has been building on for the past 3 to 4 years. And this is an area that has enabled us to gather data from DPSA, Department of Transport, and so forth. And it then allows us to be able to also do the financial disclosure frameworks, but to also generate very brief reports about the state of different departments looking at selected indicators. This data warehouse, if it is also funded a little bit more, it is one of those areas that we can expand on to gather data in the local government sphere and the SOEs that would enable us to generate very quick reports that are insightful and useful for EAs and heads of institutions. The next one, again, this simply illustrates that as the PSC, we are on the ground and we are not just looking at issues of human resource management, but we are also looking at basic issues of economic development and sustainable communities in areas that matter, because this is in line with the constitutional values of ensuring human dignity. Now, in Program 4, members, again, we continue to do important work in terms of the National Anti-Corruption Hotline, the investigation of public administration investigation complaints, and those that we are not able to investigate, we refer to relevant institutions and or executive authorities as well as local government, even as we speak, and we analyze the reports that come from them to determine whether they have done a good job, and we agree that they can close matters or they must go back and address those issues fully to our satisfaction. And the very last item, 4.6, members, again, is the ramped up of the promotion of the CVPs, which I have already spoken to, and it also forms part of what we will need to learn and develop on so that the CVPs can also find clear linkages with Chapter 3 of the Constitution, which deals with cooperative governance, as well as other chapters that relate to the expansion of our mandate to other sectors. I will skip the next slide. Again, it shows our service delivery inspections. This is one of the methodologies we use that has got an impact, and we will continue to do this minimally because of limited budget. But when we are properly funded, we are able to do more, and these inspections do have immediate benefit when we identify challenges with the leadership of various institutions and we implement, we follow up. In Program 5, members, this is a new program for the PSC. It responds to what we were told we needed to do, which is to capacitate provinces. Though our vacancy rate is very high, currently the PSC is focusing on increasing capacity in provinces, which means when we have resignations, retirements, and other means of attrition in the PSC at national office, those posts remain unfunded at the national office so that we can fill vacant posts in provinces. We are not yet where we want to be, but at least we have been filling posts in provinces, and the national office, obviously vacancy rate going higher and higher. But that is a strategic move as guided by the committee that we need to capacitate provinces. Members, I will go quickly past the next two pictures and simply say I would like to request our CFO, Mr. Momeka, to take members through the state of affairs of our budget. Mr. Momeka.
Thank you so much, Dr. Sidibe. Let me ride on the protocol that has already been established, and greetings to Chairperson and members of Parliament, DM, as well as our Chairperson. Ladies and gentlemen, the budget for PSC is an interesting budget. It's a budget that comes at a stage when our work seeks to increase. There is a lot that PSC needs to do, more especially post the advent of state capture, where had we some investments been made to PSC, we believe that the impact could have been lessened. So we are a Chapter 10 institution that seeks to make sure that the public service performs its duties in a way that is regulated in the PSC, in the Constitution. Just to indicate that from our budget of 302 million, 75% of it, or 228 million, is compensation of employees. We are therefore a staff-heavy institution. We do our work through our staff. We do not have machines that perform those duties, so we are more of an institution that really produces everything that it does through its employees. 25% is operational costs, significant part of it, just above 30 million of those operational costs are your office rentals, included there is also municipal bills. We do have other administrative costs that we are bound to incur, and some are audit costs. And we basically have around about 11.2 million to implement the PSC mandate as per the Constitution, that is per year. This includes the money that all commissioners will have to travel, the budget that they will be using to travel from that budget, and other operations will have to be funded from that 11.2 million. I think Dr. Sidibe has indicated that when there is a vacant position, we are unable to fill such vacancies. We are currently sitting at a vacancy rate from 279 employees. We are at a vacancy, we've got 37 vacancies, which basically translates to around about 13% of our compensation of our staff headcount. And that is really not sustainable, more especially for an institution that is purely dependent on its headcount to perform its duties. We've indicated that we're paying rent, and we've got 11 offices throughout the country. And just to indicate that some of the functions are centralized, I've listed all those other overhead costs below. The next slide provides a 7-year history of 3 years where we are currently, in fact 4-year history of where we were and the MTF that we are currently considering, with year 1, 2025-2026 being the base year. I think members will be in a position to really see that the budget was even drastically decreased. At one stage, there is a slide that will show that, just to indicate that the one program that appears to be the biggest program is administration, but it's actually not the biggest, because it also funds. We've got a centralized budget when it comes to office accommodation, and all the commissioners' costs are funded there, and so it really does appear to be a big program. I must also indicate that the salaries of commissioners, 14 of them, DDG level as well as DG level, are funded from that program. Then other programs, we do have the second biggest, which is the provincial coordination. That's where we have all provinces consolidated under that program. We have round about 9 staff members per province, so their salaries are also funded from that one. Then we do have other smaller branches, the LMP, which is Program 2, as well as MNE Program 3, and the Integrity and Anti-Corruption, which is Program 4. The next slide shows the same information, but in a vertical form. What is more important is what is in the blocks, just to look at the operational costs versus the costs that and compensation of employees. But we've classified those costs in terms of item classification, compensation of employees being the biggest, 75%, and the rest 25%. Next slide. It's the same information, but we've provided a percentage spread just to prove what we've just indicated. Next slide. This slide, the letters may be small, but this is the slide that I invite the attention of the members to. I've picked up. What I've done, I accumulated the data of 18 years, just to indicate how Treasury has been shrinking and cutting our budget since 2008-2009 financial year, the economic downturn, and every year we have been experiencing and incurring those budget cuts. I think they total to around about 93 million. Had those cuts not been implemented, PSC would be 93 million enabled. With the president indicating that PSC needs to be capacitated, needs to be strengthened, we continue to experience underfunding. I mean, this budget, just the very same budget that the president made an announcement on his State of the Nation address. I mean, you look at the budget, there is already a 1.4 million cut on a budget that is so unsustainably cut. And Treasury continues to cut the budget. So all these cuts have been updated and consolidated, and they give a picture of almost 100 million cut for a small budget like that of PSC. So these are a combination of allocations letters that Makura knows every year we get an allocation letter from Treasury. I have compiled those allocations letters, and these are in line with the Appropriation Act as well as the ENE. So we are providing this information to Parliament to indicate that our budget has been cut in a way that it cannot be sustained. I mean, if you look at the past 5 years, 1 year, there's a 33.9 million that was cut. The other year, there is round about 14 million. The other year, there's round about 16 million that has been cut. And this is really drastically. I don't understand the logic they use to cut a budget that is so small. I thought that I should just build up on that one. Next slide. This is just to conclude, to indicate that if really we're trying our level best to do more with less, to make sure that we are a professional, we are contributing to that state that is professional, capable, and that is also ethical. And just to indicate that we are grateful as the institution for the support that we have been receiving from the Portfolio Committee. And thank you so much. We are quite happy with where we are with the bill. This is really unprecedented. And we therefore require the Portfolio Committee to assist us in addressing our constraints, both financial and human resources, and we will continue to do more. I thank you. Thank you.
Thank you very much. Does that conclude the presentation from the PSC? Thank you so much. Wonderful. Members, we now have the opportunity for deliberations. Honourable Malinga, in the interest of fairness, we will give you the first opportunity and then move back up from yourself back to Honourable Kaba. Members, I think there are some of you who need to catch flights, and also I suspect some of the officials in attendance as well. So please bear in mind when you do your deliberations, and let's maybe try and get to our questions without too much, let's say, descriptions around the question, if you don't mind. Thank you, members. Honourable Malinga, you have the floor. Take us away. Thank you.
Thank you. Let me respect the protocol. Maybe let me start with the last presentation, but we really appreciate all presentation from the strategic planning 2025-2026 APP. We really appreciate it. The DPSA, that is including the performance plan, and the PSC. But let me start with the last one. Honorable Chair, just want to check that how efficient is the PSC monitoring and evaluation compliance with public service values and principles as outlined there in section 198 of the Constitution across the departments. Let me come, Chair, with my last question. I don't want to have that tendency of my colleagues where they are asking all questions. So when you are the last one, you don't have anything to ask. And the second one is that in terms of accountability and ethics, what impact have the PSC investigation and the grievances handling processes had on promoting ethical government and accountability in the public service? Maybe due to the time, let me stop there, Chairperson. Thank you.
Thank you very much. Honourable Matutu.
Thank you, Chairperson. Let me appreciate, first of all, the presentation, NDP, also PIC. But my question is very simple. I'm wondering, NDP ethetha nge-clean audit also monitoring employee staff. Ba uzoyenza njani na endingazi ukuthi also umbuzo wami wesibini ngaba unayo na i-mandate ye-lifestyle audit ye-ministers and the presidency, because it's very embarrassing into kubana ubone sikhokhelwa ngupresident okwazi ukugcina imali phansi komatrasi, but we are expecting the government officials bana bona babemsulwa bengenzi i-corruption, but the corruption is on top. And now here we are focusing on local government, but on top with presidents there is a lot of is happening there we don't know. So imibuzo yami yomibini, if you can take me through kwezo question ngaba on the philile emphefumulweni, because it's very disappointing. We are livestock in South Africa, ku-world. Xa kuzoba no president okwazi ukwenza izinto ezi-wrong. How much more esingazaziyo azenzayo? Thank you very much.
Thank you very much. Honourable Potgieter.
Thank you, Chairperson. With regards to the CPSI, I'm quite excited to hear somebody talking about flattening structures. I think it's the first time I've heard this in government. I would be interested to know if you, considering you're looking into this for the CPSI, do you have a template or a process that other institutions and departments could possibly model off of, or if it's something you're looking at? If you can expand a little bit, I know you mentioned briefly how you managed to bring down your 30-day payment to below 5 days. I'd just like to understand where did you come from? So, you know, what were you dealing with in order to get it down to below 5 days? And how you changed your internal processes. You did mention that you were looking into assisting hospitals, etc., with this sort of thing. I do think it could very much help at local government level, because I see it's a much bigger problem there than it is, you know, at national and provincial. Then I just, Chair, I think we'd all look forward to seeing what projects. I think you said the 14th of May. I think that would be quite an informative session. Perhaps maybe we can look at the timing for that, because I do think it might be a bit of a, a bit of a debate. Then I understand that the department is quite small, but I'm just wondering what the probability is of testing, you know, innovative solutions that are implemented by other government institutions and departments prior to them paying or implementing them. And I think you hit the nail on the head where they bring in these solutions and then they work up until the point that the contract expires, and then now you're out by sort of millions of rands. So is there a way not to have the CPSI as a, you know, check mechanism for those particular innovations? And then how would local government plug into your solutions, particularly with regards to e-recruitment? I don't know if you've seen what some municipalities are using, but I think you might like laugh yourself out the room, because we're applying via Google Forms, you know, to like, you know, anyway. So if there are options to collaborate and share budgets. Then for the DPSA, I do note your structure has 3 acting DDs and an acting DG and et cetera. If we can maybe just get a bit of a clarity on that. And there still seems to be a lot of confusion, and Deputy Minister, you'll excuse me on this, but I think it's because I don't, having no history with the Department of Monitoring and Evaluation, etc., I'm still very confused between the monitoring of the professionalisation framework between the DPSA and the Department of Planning, Monitoring and Evaluation. It seems like they're all off doing things, but we don't see that side of it. We're only seeing what's happening at the DPSA side. Then from the PSC, I just wanted to find out, I know we had on our oversight if there's any feedback with regards to procuring, particularly on your hotline outside of CETA. And the online presence, it's strange that was mentioned, because the other day I was looking for something and I found every PSC on the face of the planet except ours. Everyone else has a Twitter profile and a Facebook profile and etc. It's very difficult to find any info on our PSC, which I think is we were remiss in doing, because I think they're doing a fantastic job in a lot of areas. Then, and this is possibly towards the Deputy Minister, if we can get advice on the discussions happening possibly at a cabinet level, whether they have or they haven't, with regards to the budget for the PSC, particularly following the approval of the bill. And the PSC have even given us in previous months past an estimated budget on what they would require once that bill is processed. I would just like to say, Chair, I'm a bit concerned about the lack of protection given to commissioners and investigators, as well as the sort of extreme austerity that's imposed on them when they are travelling, as opposed to what's imposed on other officials across national government. They are not subject to the same austerity measures. And if we are planning professionalisation, it doesn't make sense to me to start cutting down the department that's actually going to start resolving the issues that you're trying to address. It's counterproductive. And I think it's a case of, Treasury dictating, and please, this is my opinion, so, Treasury sort of dictating on the basis of money as opposed to our budget being done on the basis of priorities of the administration. Thanks, Chair.
Thank you very much. Honourable Langa.
Thank you very much, Chair, and greetings to, I think it's the PSC colleagues that we had not seen, and I think also the Western Cape Commissioner. Greetings to you too, sir, as well. Maybe let me start with on the last presentation by the PSC. It's quite disturbing to see that the very most important department that should be assisting, the system in the PSA, that they are deprived of proper allocation of funds to be able to perform duties. I was just doing the maths on my head when the gentleman, I think the CFO, when he was making presentations, when he said, I think it's about 228 million that goes to salaries. For, I think it's about 279. When you do even the calculation, you're like, then what are they left with if the budget is 302, and how are you going to implement whatever you want to implement, which then could be even a challenge that they aren't able to perform their duties because the allocation is not enough, of which by the time goes on, it's very likely that we will deem them as people who even can't perform because this is not rectified. So I don't know, TM, you are here. I don't know if anything could be done around this, but it's quite disturbing. Maybe to go into my questions, it's even difficult to ask questions because some are around the budget per se. Like my first question is, how does the PSC plan to address its persistent human and financial resource constraints while expanding its mandate, as envisaged in the PSC bill? Question number 2 will be, what mechanisms will the PSC implement to ensure its independence and impartiality are maintained once the Secretariat replaces the OPSC? Number 3, to what extent is the PSC prepared to, to navigate the implications of VUCA environment, especially during the transition into the 7th administration? How does the PSC measure the impact and effectiveness of its integrity and anti-corruption
initiatives under Program 4. Given that the 75% of the PSC's budget is allocated to compensation of employees, how will it ensure sufficient funds are available for impactful program work? I also have a couple of clarity-seeking questions, but I think I'll hold on to them for now. Then maybe to move on to. Oh, I still have GEMS here. Oh, they have left. I was hoping they'll come back.
You still want
On the CPSI, I think it was on slide 10 for Program 1 Administration. Where's the gentleman? Oh, there. Yeah. On executive support, what measures are in place to strengthen internal audit functions and align them with innovation-focused outcomes? Corporate services, what are the current challenges facing corporate resource management, particularly in the ICT and auxiliary services? What strategies are being implemented to improve operational efficiency across all corporate services? And in the office of the CFO, if you can elaborate on what current financial management tools are in place to measure the return on investment of innovation-driven projects. Number 2, how does the office of the chief of the CFO ensure that the procurement processes are both compliant and agile enough to support rapid innovation? I think it was on slide 10, Program 2, Public Sector Innovation on Institutional Support and Replication. What are the success metrics used to evaluate whether a piloted innovation is ready for replication? And how does CPSI support departments in adopting and adapting innovations without disrupting service continuity? And what are lessons can you say have been learned from the previous replicated models in terms of scalability and sustainability? And then I go to the doctors, Dr. Sedibes. I'll be done just now, Chair. I'm very mindful of time. This is for DPSA. How is the department measuring departmental compliance with the national framework towards the professionalization of the public sector across all provinces beyond self-reporting mechanisms? Number 2, has the department identified any emerging patterns in the 5-year tenure data of accounting officers that suggest instability or dysfunction, particularly in high-capacity departments? And if so, what can you share relevant details? Also, how does the department plan to ensure that the findings from the skills audit are aligned with actual service delivery challenges in critical departments such as health, education, and public works? Yeah, I had quite a few questions, but I'm trying to. How will the department address potential loopholes that still allow public servants with unresolved or concealed disciplinary histories to re-enter the system in different departments or provinces? Yeah, maybe, Chair, if I can pause there for now because I have quite a few. But maybe I missed welcoming all the presentations from the 3 departments when I started getting the platform. Thank you so much, Chair.
Thank you, Honourable Langa. Honourable Ndamase.
Thank you very much, Chair. To DPSA, can they shed any light in relation to the turnover rate of the accounting officers in the 7th administration? Only at this level, at national level. If we go down to provinces, that may be too long. Just looking at there. And then looking at the disciplinary cases, there are disciplinary cases wherein they take more than a year. Then the question is, are you not contemplating as the department to be able to say, to shout out to departments to hand over those cases so that those cases can be resolved by this department when they go beyond a year? The second question in relation to the disciplinary cases is whether you have benchmarked at an international level so that you can have the best practices in dealing with this challenge of the disciplinary cases that take longer. Can you shed any light in relation to that? Then on the lifestyle audits, are there any gaps that you have observed in relation to the lifestyle audits now that you have decentralized the issue of dealing with the lifestyle audits? That's that on the DPSA. Then for PSC, it becomes very difficult. Let me align myself with the questions that have been asked, but one clarity that I would like to get from PSC is that sometime last year you came and as part of your planning was that you wanted to introduce the enterprise resource planning. Now I'm looking at this 74 million rand, which is 25% of your budget for 2025-26. My question is, have you also budgeted? Is it included there, the work that relates to ERP that you are contemplating? If yes, how much are you going to be able to take out of that 74 million that is allocated there? Thank you very much, Chair.
Honorable Kilisha.
Thank you very much, Chairperson. Good evening again to the Deputy Minister and you, Deputy Commissioner. Let me start with the Department of Public Service and Administration. DM, it's just a few questions really. I just want to maybe find out first, how will DPSA make sure this time around that the departments follow the rules? Since in the past they didn't do that. So if you say the department must do a regular performance review and they ignore it, I just want to know, how will you this time around make sure everyone sticks to the plan? And whether there will be penalties or surprise checks that you will be doing. And maybe another one is that, what are the real actions that will be taken quickly to catch and punish the government workers who steal and live beyond their means? I know that we've asked a lot about the lifestyle audit, but I just want to know, let's say if an official is earning, let's say 30,000 a month, and then suddenly owns a mansion and luxury cars, how fast can the system check that and the investigation take place and take action even? And another one is is there maybe a clear schedule for when people can start using like the online services? Let's say you want to apply for grants, you want to renew your license, or even book, for government appointments. When we're doing oversights, we realize that there's a lot of frustrations, especially when people have to be subjected to going to government offices, So I'm just wondering if we can finally expect, a a time frame to say by 2025, by the end of 2025, we'll be able to apply for the grants online, and we'll be able to renew licenses online. And maybe when we, for SPSI, I just want to know, how do you keep getting clean audits, especially because you don't have like the top executive? I know that there are vacancies there. I just want to know, how do you keep, getting these clean audits when you don't have the executive directors and stuff like that? And maybe this goes with, maybe how do you deal with the 12% vacancy rate while keeping the work running smoothly? How are you managing to do those things? And also there, what is it that you keep, how do you keep making sure, oh, I'm trying to rephrase this question. How do you make sure your plans line up with the bigger goals of government? I think that's what I want to ask, because I think I just need to understand the changes that were made to targets after getting a feedback from the Department of Planning. I don't know if they can respond to those questions, Chairperson. And when it comes to you, Deputy Commissioner, I think we've been asking you questions since the beginning of this administration. I no longer know what to ask you now. But going through your presentation, I know since the 84% of the 62 million budget that has been committed to you, how do you then? So I know that with the 62 million, 84% of it is already committed to mandatory cost, right? So what I want to understand is that that's leaving you with like 11.2 million for your programs. How will you then manage to carry out the responsibilities with that limited funding? I think that's the only question I have for you, is that because I know that, your funds are really drained, how are you going to make sure that you carry out the programs that you're supposed to? Thank you, Chair.
Thank you very much. Honourable Tikana.
Thanks, Chair. On welcoming all the reports, Chair. On CPSI, my interest is how do they work effectively with an active position for a long time without filling the vacancies? And they must take us through on the process plan to conclude the recruitment process they have started for the post of the executive director, which have been vacant, I think, for some time, and the processes of recruiting were initiated. So when can we see the implementation or the filling of that vacancy? And linked with that, how can you work with offices of premiers in various provinces to showcase the innovative solutions you have, and in trying to assist the provinces in improving, in addressing the service delivery challenges? DPSA, you have, I know this might not be, this might come up from our report of oversight, but it might have a linkage because of the budgeting processes. You are having a one-stop center which have been your child for almost 11 years. You want, as a pilot, you want to hand over now that to the Gauteng government. Yes. Are you not transferring a premature baby. Considering as much as it is 11 years, as much as it can work, and what are the key? Is it an unfunded mandate to that government of Gauteng? Because if you are transferring it for the first years, I believe that you must prepare them for that. Is that not an unfunded mandate to Gauteng government if you are saying we are, and are you confident that you've taken it for 11 years, you are saying it can work? I won't talk about the shortcomings we have observed when we were there, but you are very confident that you are ready. But for me, is that not an unfunded mandate to that to the government of Gauteng? Even the Honorable Deputy Minister, there are still vacancies of senior positions in the department. What's the plan of the department? Because it's either the implications will be you fill the vacancies late, there is money, there are savings which might be transferred for other areas of need in the department. So when do you plan to fill the vacant position, especially the acting positions in the department and any other vacant position? Thirdly, in one of your responsibilities is to engage with labor. Do you still see that the performance, issue of performance, is there any fairness in implementing the performance bonuses and others? Are they not promoting patronage in the senior management of government? Because in my view, or in my observations, people who benefit in that processes are the very senior managers, not those who are at groundwork doing the work. So loko bebekwa ku-3 bona at an average level, and you can see that there's a gap, because apha phezulu uqala pha ku-DDG, chief director, go for no 5, but those who are doing groundwork bafumana o-3 okanye bangafumani kwa bonus. Which system is better off? Is this not being misused for patronage purposes, that system? Because if that, it means we have to review it. And I'm raising this because you are the ones who are having a mandate of engaging with labor. I think we have to look and just assess it and its implementation. I'm talking possibly because they don't receive annual bonuses. They receive performance bonuses. I'm not sure. But there are those who are double dipping, getting their bonuses and also performance bonuses, whatever. Because in my view, if one is, we should have clean audits in all the departments if we pay performance bonuses for those people. Because for me, 4 or 5 is over performance. So if everyone is receiving a bonus, why don't you match that with the performance and outcome of service delivery and also the audit outcomes? My last point is on PSC. Have what the plans of upgrading your hotline center? Do you have budget to upgrade it, as you understand your infrastructure is deteriorating? And also, are there no threats to commissioners or for commissioners when they are security threats when they are performing their duties? Thank you. Thank you, Chair.
Thank you very much. Honourable Klapa.
Thank you very much, Honorable Chairperson. Let me welcome the presentation from 3 entities. Chair, let me start with what is this one? CPSI. CPSI in his presentation talks about the innovation solution. And it also mentioned a critical department, which is Home Affairs. The department that have a highest note with corruption, but they are busy praising it. Also, a DP, also the DPSA. The acting director was praising Home Affairs here. Yeah, I was so shocked. I don't know whether the acting director knows knows nothing about the Department of Home Affairs, about the corruption that is there. Many South African, millions, their numbers of ID are duplicated with the officials of Home Affairs selling their numbers to the foreign national. That department, I don't want even to talk about myself because it's cracking my head. In my PCO office in Tembisa, you can go there and you find the report about this Department of, a special Captain Paki department. Yes, I was thinking that when presenting to say you are on the ground, which ground are you in? Because I'm on the ground myself. I can give you all the report about this department that you are overseeing. You see, let me tell you, social development, what? SASA, Home Affairs, Housing Department, they are the most highest corrupted department. Those departments. Why I'm saying this? When the people supposed to get their RDPs from the housing, official of housing, they tell them that they must give them 15,000 for bribe. But you came here to tell us about the Home Affairs, the most corrupt department. When are you going to assist this department to get away from corruption? When? Because sometimes when we talk about this department or principals of this department, they told us that, hey, this issue, they are in court. If unane court into abantu base South Africa, kukhona ama entities ne DPSA is supposed to deal with this thing. Finish and for all. Finish and clear. If unali issue yakwa Home Affairs court nikhona, but we are on the ground. Which ground? You see, sometimes it's good to write a paper with a good English, but you don't know that you uzothola thina esingabhali English, esikhuluma ngo nabantu, asibhali nix thina siyakhuluma nabantu ukuthi inkinga zabo yini, nabantu basitshela inkinga zabo. It's better nihambe niye ebantwini niyobabuza than before nibhala. Ningavele nibhale ngoba thina abanye niyashater. Mina ngihleli nenqwaba yabantu abasenkingeni ngeHome Affairs. I-office yami isethembisa if ufuna ukubona. Uze khiphele. Ukuthi bona ke inkinga zeHome Affairs leyo khuluma ngayo othi innovated by who? Innovated to corrupt, to be corrupt. 10 years. Can I tell you that If I can open, if you can allow me, I can open. Listen. No, I want them to listen. Oh, not now. I will open for them. They will hear the VN here. A person telling me about 10 years being corrupted is his ID by the official of Home Affairs. But to talk about innovation, whatever solution, there is no solution. There is no innovation in Home Affairs. Please, guys, when are you going to innovate this department so that the people of South Africa, they'll be out of jail. They are in jail, people of South Africa, according to their IDs to the foreigners. Because some of them, they have kids, children. They can't even access grant for their children because their IDs are being duplicated with foreign national. And no one have that solution to help them. They are the real citizens of South Africa, but they are in jail according to their numbers of the IDs. Because if you are in jail, you can't do anything. You can't access any government, government things like a 350 grant. Many things that you're supposed to access, but you cannot if you are not having a IT. So, Chair, one of the members asked the question that I was writing here to ask about it. The acting DGs who are acting. And for that acting is a problem. Because they cannot take any decision, these people. They are not hired. They want to be hired. If they take decision, they will be fired. How? Are you taking a decision as who? Because you are acting here. Why? No. The acting must be 3 months. After that, hire a person so that the person will be having access to take decision. Can't act for 10 years or 10 months. I was wanted to ask, but we are talking about with constitutional values. Guys, this constitution that we are talking about, masingadlali a constitution. Khona manje, as we are here, I'm telling you that we are depriving South African the access of government. What is this? Government access the government services. Because even if you have a money you have a bank, you can't access the bank if you don't have an ID number. You cannot. Please, guys, can you go down and help these people? So that when you come and report it to us, we'll report with a clear understanding that you have done a job, a well-done job. Thank you very much, Chair.
Thank you very much, members. I just have one question to add. I'd just like to understand from the CPI if you need to work with other government departments, what is the role of CETA in terms of, so you mentioned that you have various technological solutions, but I understand, what we understand as a committee from our visit to various departments is that most government departments can't procure any IT solutions without going through CETA. So I'd just like to understand your relationship with them and if you are able to engage innovative solutions to departments directly with those departments, or do you actually need to go through CETA as well? I'm going to then give your department the first opportunity to respond, then DPSA and then PIC, just as the presentations was. So you can please proceed. Thank you. Yes, Honourable Kraba.
I forgot to tell them about the office that ngibuya kiyo 2 weeks ago. Msinga. If unikhuluma digitization, in Umsinga municipality, local municipality, there is a problem in the Home Affairs. When those officials were called, busy, saving people. This digitization shutdown in the middle of the work. People are sleeping there from Monday until Sunday, waiting for the system to be digitized. If you are talking about the digitization, go to Msinga, help them about this digitization so that the system won't shut down in the middle of the work of the official. Those officials, they are willing to help people, but there is nothing they can do because digitization shut down. When it shut down, they just fold their hands and waiting for it to come. Please help them with this digitization.
Thank you. Member.
It's small, but I believe it's critical for the committee or to Public Service Commission. There's this case, the Concord case on municipal workers, senior officials to hold political office. And I don't know whether you've looked on it, checking it, linking it with our bill, which we've just referred to, NSOP. Won't be any challenges for us to take it back and correct if there are any matters which are linked to that one. Which one? The Concord case on municipal Concord case on the employment of senior officers holding political offices. Then bati right, naba safe.
Thank you, Honourable Member. I don't think that there will be an impact on the Public Service Commission bill, but if there is, the opportunity is in the NCOP to have that corrected or changed, and then sent. We will obviously it will be sent back to the NA after that. So there is a opportunity in law to still do that. Honourable Langa.
No, apologies, Chair. I was just checking time, and I think we have about 3 entities, and there's quite a number of questions that we're anticipating response on. That maybe in the interest of time, Chair, maybe if I propose that maybe we have some responses in writing, since we also have some people that need to travel. So it's just that proposal, Chair. Thank you.
We have all the time. Yeah, especially from your questions.
I appreciate the recommendation. I think I'm going to give all the entities a possibility to just answer verbally what they choose to answer verbally. But in the interest of time, I also would understand we are over time. So if somebody needs to catch a flight, I'm happy that they provide further answers in writing to the committee, and that they excuse themselves for the flights. On that basis, you are welcome to proceed.
Thank you, Chair. Yes, we would really want to make use of that offer, but I would like to respond just maybe on 1 or 2 of the critical issues, because there are some of the questions about, for example, the flattened structure, how do we go about with the 30-day payment, that I think we can better respond in writing and give feedback. I would like to respond, and I'm sure the DM would also like to come in here on the issue of the vacancies. On the 12%, I think it's an issue of statistics. There are 5 vacancies. 3 are currently being filled, and 3 of them became available only on the 1st of April. So it's impossible to have filled them by now. So it's a matter of statistics, and we will definitely be able to deal with them. On the matter of the executive director, and this cuts across 2 or 3 of the questions, I'll ask the DM to respond on the process, but the process is currently underway. Shortlisting actually took place yesterday, if I remember correctly. So that process is underway. But the important part is that as management and in collaboration with our political principals, we took a decision that we're going to forget about the acting part, and that the job is to be executive director, and for the last 4 years the person in that position was the executive director, and management supported and staff supported. So there was no waiting for decisions. We took decisions and we implemented, and that's why we were able to achieve those clean audits. I must say we work with amazing staff. And if you look at our corporate services, we have 3 people at HR, 2 people in supply chain, 4 people at finance. That's it. And the level is at deputy director and lower. But we work in a matrix integrated way. So in terms of the 30-day payment, for example, everything is done electronically. An email for an invoice doesn't go to one person, because what if that person is on leave? And that's what happened to us in the past. You miss the 30 days because someone is on leave. So everyone in finance and everyone in supply chain receive the electronic invoice, and they can be checked in terms of when the payment has been done. We had to be very clever in terms of segregation of duties. We had to introduce electronic stamps so that the whole process is digitized from the start to the end, and therefore they can make the payment even in 2 days or 3 days. So those are some of the issues that I think we want to look at more closely. In terms of success matrices and how do we go about, every project determines its own success factors, and we measure. That's why we don't have a milestone approach to project management. We have a stage gate approach. So whenever we reach one of the stages, we have to ask, because it's innovation, it can be a huge failure. So we have to say go or no go at the next stage, and our success criteria then determines there may be unintended consequences that we didn't foresee. And then we need to stop. And that's the point why we only put 2 projects per year, because we may endeavor to do 10 projects, but 8 of them are failures because there were unintended consequences or not financing and so on. So these are the kind of initiatives that we are then driving in terms of the piloting and testing. On the question around us being some sort of a clearinghouse for these failed projects, unfortunately, we can do about 2 projects a year. But what we have done, and that is something that we will discuss in terms of also the question on the OTPs, we have created a network of all the offices of the premiers, all the developers, all those responsible for IT, so that we can use that collective group to do a clearinghouse. And the principle that we want to achieve, and that comes to the relationship with CETA as well, is if there is an in-house solution that does not have to be procured, then we implement. And that's how we distinguish our role from CETA, is to say priority must be given to in-house solutions, because we can maintain those ourselves, we can roll them out, and we can have collective capacity to implement. We can share the code on a dedicated GitHub facility that we have created, where only public servants have access, those that are allowed, and then we can share code and documentation in that way. And that's what we want to do, different from what CETA is doing, because many of the departments can't procure these solutions because they simply don't have the budget for it. And maybe a last comment on the issue of Home Affairs. And similar departments. I think we share the pain of citizens in this regard, because we don't look away from areas where there's, for example, corruption or problems. But we are approached by those small areas of excellence within the department, people who really want to be making a difference. And then we assist them to at least carve away a little bit of the problem and more of the problem. And that's why we're working closely with the willing amongst the public servants, and there are many of them who are not corrupt, who really want to make their contribution. Chair, I think the rest we will respond in writing accordingly. Thank you very much.
Thank you. DPSA.
Thank you very much, Honorable Chair. Yes, I'm beginning to like this committee. I think I need to appear every day. I like the passion, Chair. There's a passion that we carry as public servants. So it will help us a lot. There are a few questions raised here, Chair. Let me start by the very same question raised by Honorable Malinga on the issue of ethics and discipline. That question was raised 4 times by Honorable Malinga, Honorable Langa, Honorable Ndamase. Ndamase read it twice, even on the benchmark. Our response is, Chair, we've cleaned up the database of discipline management. We've done a lot of work. Currently, if you go back, you can hardly find people who were suspended for more than those years, 2 and above. We're still busy. When I was presenting, I said, what will happen by this year? The ministry will launch what we call the database register for all discipline management across the 3 spheres of government, so that we know the process, where the case stuck, we can provide that technical skills to unstuck it. So that one we can share with you. We've saved a lot of money. The report is ready, Chair. You can call the minister and DM to come and present the development currently. So we've done a lot of work. On that one, Chair, we are quite certain that it was one hole that government was losing revenue, but we've done a lot of work that we can demonstrate going forward. The second question asked by Honorable Matutu on the lifestyle audit, it was asked 3 times by Honorable Matutu, Honorable Ndamase, Honorable Kilishe. Now, what we have done now, we have now entered MOU with the law enforcement agencies. Your SIU, the Hawks, and the SAPs. Come back to the question raised by honorable members to say, what is the consequence? Yes, indeed, if you are living beyond your means, in today's world, it's very easy to get you. Very easy. I just take your ID number, I go to the D's office, they punch it. The whole of you appear. The whole of you appear. We go to SIU, we know public servant today. That's the reason why we're saying now we've done it with the supply chain officials. All SCM officials go through the process of lifestyle audit and vetting. It's a requirement now. We're moving to finance officials. These are sections or pockets where we find out that corruptions was being to be rife. If you tighten there, we go to line functions. Those who push the papers, those who bring the files. So those are non-factors, but yes, indeed, our partnership with the law enforcement agencies is bearing fruit, Honorable Chair. You may bring in SIU here. They can share with you how much we are recovering as a state currently in that regard. Go to the next question asked by Honorable Potgieter on the DPME role on professionalization. DPME do M&E on performance and planning cycle for the state. Professionalization is the role of the DPSA, PSC, and NSG. We've got a component in that regard. When Principal was saying in the morning, talking about how they're beginning to transform the mindset of public servants on training. From our side, it's a behavioral patterns on the issue of integrity and ethics. And the PSC will listen to their presentation on the values that we will collaborate. They issue a lot of reports, PSC, that they're very useful. We make use of their reports to do other policies in that value chain. So yes, indeed, we appreciate that. But I can assure members, the tide is beginning to turn. It's turning very slow, but we'll reach there one day. The next question asked by Honorable Langa on the issue of compliance. The same question was asked by Honorable Kilishe. When the minister was saying in the morning, and the deputy minister touched on it, she even gave an offer to say, you can call us back. There's a provision in the law that we're not making use of it effectively, because we're still beginning to provide some green field on how people should begin to behave. But the law is saying, if there is a non-compliance, Minister must prepare a report to the legislation, to this committee, to present non-compliance of public service, whether it's a dear colleague, whether it's other departments. Minister can also share the very same report with cabinet, the president, to say, Mr. President, these are non-compliance that happen to different ministries. So from now, we'll begin to use that provisions. Secondly, members, we've got an office called Office of Standard Compliance. That we said is incubating the department, but its main role is issue of compliance. That office look at the standards that we issue across the public service, not for the DPSA, but for the public service, and prepare its own report on non-compliance issues for the minister's interventions. So that question, members, is taken care of. It's upon us now to appear before you with all those non-compliance report, because the law said, Section 16A of the Public Service Act provided this committee and Parliament to call the minister to provide such a report. The next question asked by Honorable Ndamase, I've answered all these three questions. The last one I give to DDG Linda on the rate of HODs. She'll answer to that. Honorable Kelishe, I've answered the issue of actions on ethics, Section 16A on follow-ups. The last question, Honorable Kelishe, it was answered by my colleague, Pierre from CPSI on the online services. The next honorable that answered the question, Honorable Kava. Let me start by Honorable Tikane. On why do you want to hand over one-stop shop to Gauteng and unfunded mandate? Honorable Tikane, that's a good question that you are raising. DPSA, we don't deliver service, but we deliver all services. We don't have capacity to go and issue IDs. I'm giving a simple example, but we deliver all services. When Cabinet says DPSA establish an urban Tusong centers, they borrowed concept from other countries. When it mature, hand it over. You raise a very good question to say, is the Gauteng province a relevant place to be? No, it's not. But as DPSA, we've knocked on everybody's door to say, here is the baby, this baby is matured, must find a home. Everybody closed the door. And Gauteng said, hey, this baby is here, is servicing as far as welcome. That center is very busy. I'm happy you were there. It's the biggest center today in the country. That model is a good model. Now, Gauteng is delayed to take it over. Your question is, DPSA, hold it back. God have heard your prayer. We took it back. It's with us now. We're discussing the model going forward from the pilot to the real urban center. How can we model it and franchise it to other provinces? Because KZN and Free State, they want the same model to say, come and help us. So yes, indeed, we have taken advice, Honorable Tikana. We have taken back the center. It's with us. So yeah, but it's a very busy center. It serves close to 4 million population every month. Services the entire Gauteng, even beyond Gauteng. Honorable Kaba, I said we don't deliver service, but we deliver all services. I'll appreciate to get all those complaints through the DM's office. All those complaints from your constituent office in Tembisa, we've got a mechanism in the department that addresses such complaints. So we'll appreciate to get all those complaints, and I still encourage all honorable members, if you happen to find such things, my deputy minister is here. Make use of our office. We've got mechanism. We've done a lot to help, but some we don't know. Honorable Kaba, but we want to assist. That's our passion. Fortunately, the DM and the minister are very passionate to be on the field. We spend most of our times on the field addressing such questions. So I'll appreciate to get a submission. We can deal with those issues. I think I've covered all questions. I'm skimming through. I've covered all questions. Only one question that my colleague will answer to it, DDG Linda, on the issue of the turnover. Lastly, on the issue of vacancies, this matter now is in the hands of the Deputy President. Last week, he wrote to the minister to say he wants a plan how government will address issue of vacancies, including this that we are raising here in this meeting. So as DPSA, because we manage the entire public service, we'll develop a tool, a system that will detect. We own PESAL. Everything's on PESAL, by the way. We own PESAL. Secondly, we're committing to say we'll provide directions on how departments must begin to fill their precisely the funded position. Why take a year to fill one position? So it's something that is in our hands. Minister replied to the Deputy President to say, Deputy President, we take this thing very seriously. We'll come back and report on these issues. Thank you very much. DDG Linda, take that last question.
Thanks, DG. I think I did indicate when I was presenting that the last study on the tenure of HODs was done during, if not the fifth, the sixth administration, and it established that the average tenure was 2.7 years out of the 5-year contracts that HODs have. So for the seventh administration, as indicated in our APP, we will be starting with the monitoring this year. So as of yet, we do not have a report. But I think as we come to the committee to give reports on our quarterly APP progress, we should be able to start indicating what we are finding with respect to the tenure. So we don't have the data for this year yet. Thanks, Chair.
Thank you very much. PSC, you're welcome to go.
Thank you,
Deputy Chair.
Honourable Chairperson, and thank you to for your questions, honourable members of the Portfolio Committee. I'll just go through most of giving responses to most of the questions which were asked. But regarding the questions that have to do with finances and budgets and ERPs, I'll give opportunity to CFO Momeka to actually respond to those ones. So when it comes to M&E compliance with CVPs, how do we make sure that our functions within the PSC promote the promotion of our constitutional values and principles? What the PSC does, we have a CVP's dashboard per department, which actually measures the performance of departments per CVP that we have in Section 195 of the Constitution. So we have a dashboard, and we give advice and we recommend to EAs or ministers how they can improve their adherence and compliance to the CVPs as per the measurements matrix we have on the dashboards that we produce as the PSC. We also do a lot of advocacy work and partnership work with institutions like your moral regeneration movements, whereby we partner up and collaborate to promote our constitutional values and principles. We have the FDFs, which is the Financial Disclosure Framework, which manage and regulate issues of potential conflicts of interest. So there are a number of activities and interventions that we have produced as the PSC to make sure that we comply with the promotion of our CVPs as mandated by our Constitution in Section 195. When it comes to the promotion of ethical governance in our complaints and grievances, what we do, we investigate complaints and grievances that have to do with unethical conduct, as well as unfair labor practices through our GCPs, which are our grievances and complaints panels. So we have investigators who investigate. Then as commissioners, we sit together to basically make rulings on the investigations that have been put before us. And most of the investigations have to do with unethical conduct. And then we make recommendations to the ministers or issue directions regarding how they can actually make sure that they adhere to their constitutional mandates as ministers. And that's how we promote ethical governance when it comes to our complaints and grievances as the PSC, through our investigative work that we do and our engagements with ministers on that work. When it comes to the issue of the mandate that the PSC has of lifestyle audits of EAs, currently the Public Service Commission doesn't have a mandate over executive authorities. We only have a mandate over public servants. The one institution that does have a mandate is the Public Protector. And that's where we make referrals to the Public Protector when it comes to issues of unethical behavior on the part of executive authorities. But I would like Commissioner Seal to maybe elaborate a little bit more about the PSC mandate of our executive authorities, in particular our mandate when it comes to lifestyle audits. But I do know that the DPSA is doing work on lifestyle audits, but Commissioner Seal will elaborate more on the differentiation between the work of the DPSA and the PSA when it comes to lifestyle audits. When it comes to procuring outside of CETA, we had a meeting with the communications minister to ask for an exemption as a body which is constitutionally protected to be independent. I do know that the Minister of Communications is currently has currently put before the House a law that exempts smaller departments from procuring through the CETA, but there's a debate in the House between the chairperson of the Communications Portfolio Committee and the Minister, and they're not finding each other. So as the PSC, we will wait for that particular process to unfold, and we will comply with whatever recommendation is made by National Assembly in as far as that particular law is actually concerned. When it comes to the PSC and visibility in social media, we would like to raise to the House that we are visible on all social media platforms, including our website, our Facebook, LinkedIn, Twitter, and Instagram. So I'm surprised that Honourable MP Potgieter said she cannot find the Public Service Commission online. We are online, we're active online, and we try to produce content on a regular basis through these platforms. We also have our citizens forums where we engage directly with communities to make sure that the branding of the PSC is visible where it matters most on the ground. We do inspections and we do a lot of on-the-ground work as well as online work through our communications unit. When it comes to the issue of the budget and how we will overcome the budgetary constraints that the PSC is actually faced with, we have a meeting with the Minister of Finance on the 29th to discuss how they can make provision for additional funds for the PSC in order for it to operate and actually fulfill our constitutional mandate. We have developed a business case, and our business case is that because of our interventions as the PSC, we are actually saving government money. For instance, the proposal to make sure that prolonged precautionary suspensions are addressed by the Minister of Public Service and Administration will save the public administration millions of rands. And we're also working on issues of ICT and functional accommodation, which has the potential to save the state millions and billions of rands. So the more money we do get as the PSC, the more we can do in saving the state in terms of costs of its inefficiencies. So we've developed a business case which will be presented to the Minister of Finance on the 29th. We would appreciate it if the Portfolio Committee also engaged the Ministry and the Minister and put pressure through your powers as the Portfolio Committee and as Parliament to make sure that the PSC gets funding to run its operations and to fund its programs and to fund our constitutional mandate. When it comes to the issue that Honourable Member Glelisha asked about budget constraints and programs. How do we actually run our programs if we don't have money to do so? We actually try to do more with less. And this is the philosophy that the Public Service Commission has adopted, doing more with less despite the odds. And how we do this, for instance, we reviewed the service delivery approaches and methodologies. For instance, instead of traveling and going on the ground doing service delivery investigations and inspections, some of the work is actually done in the office and online and using desktop research. It's not the most effective methodology, but we've had to revise our methodology levels and review our delivery approaches in the face of a shrinking budget for the PSC. We also train our staff to multitask and to work across different areas of specialization, even though this has the risk of burnout, particularly in the context of resignations and long-term illness within the organization. But we do train our staff members to actually do more with less, to multitask, and to basically work across different areas of specialization. We also partner up with institutions through our MOUs, like universities and research institutions who work with us to make sure that they provide added capacity. And that's how we've been able to augment our service programmatic implementation, service delivery delivery in the PSC in the face of a shrinking budget. When it comes to the question of security threats of commissioners, we are engaging with law enforcement agencies like the South African Police Service, in particular when it comes to vetting the security needs of commissioners, in particular the chairperson, who is obviously at the apex of the organization, as well as the commissioners who are dealing with very sensitive cases. It is on our agenda to make sure that commissioners are protected, and also investigators who are dealing with sensitive cases also receive the protections they require from our law enforcement agencies. So I know that when we went to one of the provinces, we were actually held hostage by a business community that was demanding a tender to be given for the services being provided for that particular event. So there is potential threat and real threats imposed on the commissioners because of the very nature of the work we do, dealing with issues of misconduct, corruption, and all of those things. So we are placing the issue of security provision for the chairperson and commissioners and investigators dealing with sensitive cases as a matter of priority. And then when it comes to the Concord ruling of municipal workers, I know that the Concord ruled that it is not constitutional not to allow municipal workers not to engage in political leadership activities. It's because it's against their constitutional right to political association. However, our bill doesn't impose that particular provision. But I do know that perhaps the Director General of the DPSA can advise whether or not PAMA and the Public Service Act speaks to that particular restriction and how they plan on overcoming the Concord ruling on this matter. I would now like to hand over to CFO Momeka to respond to questions regarding the ERP and other financial related matters. And also I'll give opportunity to Commissioner Seal to respond on the question of the PSC mandate when it comes to lifestyle audits of EAs, as well as opportunity to acting DG Sedibe, as well as Mr. Sia Giyose, should they have any comments to make or responses to give on the questions raised by members of the Portfolio Committee. Thank you very much, Honourable Chairperson and members, honourable members.
Thank you, DC. Let's start with the question that was posed by Honourable Glelisha on the clean audits and yet vacancy rates, high vacancy rate. The truth of the matter is that it is tough. We try our level best. Segregation of duties is getting compromised. In particular, in the administration, we don't even prioritize those posts. We prioritize at least functional posts But you have a situation where certain transactions will need more than one person to ensure segregation of duties. That is getting less compromised over and over again. In fact, we are thinking that if the situation worsens, it may even compromise our clean audit, which will also weaken our voice, because we believe that we have to walk the talk. As PSC demand or expect that other institutions will have a clean administration if we ourselves are. So we think that is actually risky. So as CFO, I am worried. I just want to be honest. With regards to the 11.2 million, how do we carry out our responsibilities with limited funds? Yeah, it's a tricky one. I think the DC has responded. The truth of the matter is that PSC cannot afford to operate full-time, bringing staff full-time to office. We do have a hybrid method through which we are saving on utilities bills. So we take that as part of our strategic initiatives to ensure that we are able to meet our obligations. We are saving on telephone costs. We are saving on data usages, and yes, we know that staff are also, but we have implemented controls to make sure that our staff remains productive. We've even made a study just to look at cost saving versus productivity. Productivity is not compromised in any way, but we are forced to implement some of these initiatives. I wish to invite members to observe the 2023-2024 financial year, where our budget was cut, and it was cut in such a way that even salaries of permanent employees were cut. Technically a retrenchment, if I were to call it. Treasury then corrected it by injecting, undoing what they did for that year. And there was a 12 million that was added in 2023-2024 financial year. It was added, I think, in the budget day, but as a second adjustment budget. Please observe that. So these are the decisions that are taken at Treasury level and get corrected. It makes planning difficult. I wasn't sure what was the logic behind that, but I'm saying this out of respect, without undermining anyone's professionality. So we raised that, and yes, with the issue of NAG, Honorable Dikana, plans for upgrading. We have requested CARA, the funds, proceeds that were generated from crime, and we've made an application. Unfortunately, CARA did not fund us because we needed to upgrade our system, the NAG system, anti-corruption. But we were able to get a promise from UNDP that they are willing to engage us on this matter. Now, this is an important project, but it gets funded from donors. That's the situation that we are in. Let me go to the question that was, I think, posed by Honorable Ndamase on the ERP. And Honorable Ndamase is not posing this question for the first time. So the ERP will be when PSC is no more a government department. As long as you are a government department, we are on LOGIs, BAS, those transversal government departments. So when we move over to the model where the bill is enacted to law and we have to move, we will be an independent institution from government, and therefore we will have to have our own independent system. The ERP system that we have looked at doesn't cost us that much. If you look at the business case that we have presented here, the first year, we are looking at around about 6-7 million. In fact, almost 8 million. It's 7.8 million, 6.8 million. So almost 7 million. That we believe that we will be in a position to source an integrated financial personnel procurement system. So we have looked into that. It is so that which you have the budget that you have highlighted now seeks to finance operations prior to us becoming an institution. So we've got and also let me respond to the other question on, so that I'm a bit structured on when we move over to a bill. We have submitted a business request to Treasury where we have costed when the bill was, we started with the process to have it enacted to law, this new PSC bill. We also costed that bill. We submitted a business case to Treasury. It has been a matter that we have been engaging with Treasury, indicating to them that should we get to a stage where the bill is enacted, then we will need funds to perform the work that we currently cannot perform in municipalities as well as in entities. So that business case also includes the procurement of the integrated financial management system, which we have clearly costed looking at the size of the organization. The one that is quite multi-millions, 100 is for much bigger organization, but looking at our organization, it goes per size. So we are quite happy with that one. It is not part of the current budget though. I think the DC has responded on the SETA, but just to indicate that there's a letter that was also sent by our chairperson to SETA, because to the SETA minister, there has been communication in that regard. There was a question that was posed, I think, by Honorable Langa with regards to, in the midst of these budget cuts, how then do we plan to achieve our goals? I think I've responded to that, similar to the one that was posed by Honorable Gleshe, that we just do little, we do more with little. So that's what we do. We go to an extent of not even buying tea for chairperson's visitors. So we've centralized even just buying lunch. It's DG who must approve. No, none of us here, other than the acting DG, can approve. When a commissioner has to travel, Commissioner Sil, for him to travel, he has to submit a form. I must also apply my mind. Then it goes to the DG, it goes to the chair. So we're using those strict. But I must say, commissioners and PSC employees, they do understand. They understand the situation that we are in, and they are not making it difficult for us to implement that. So we do have willing participants to cost saving. They're quite an amazing team. Let me also recognize the role that Minister, Deputy Minister, DPSA have played in making sure that we are an organization that continues to operate the way it does. Even in the past, we had a situation that Evogela, you would remember, where DPSA, we had a pressure and they decided to reprioritize some of their budget and avail, I think, around about 4 million that Makura, you'll remember, to DPSA. So we are that a street kid that puts a board and go around asking for money. But we do have partners that are really willing to assist. So that's how generally we survive. We're trying our level best to make sure that we comply. I just want to make sure that I've responded to all the questions. I think I have responded to the financial related questions. I thank you.
Chairperson, thank you very much. Or is there anyone coming?
I think the Commissioner, did you want to add something as well?
Yes, Chairperson. I'll be brief though, but the Deputy Minister can go before me. I don't have an issue. Okay, I'll proceed in the interim. Just a few issues, Chairperson. My Deputy Chair asked me to address the issue of the mandate of the PSC. I think it's important for us not to lose sight of the fact that we're a creature of statute. We're created by the Constitution, and we also have the current Public Service Commission Act, and that frames our mandate. And that tells us what power we have. Any activity or conduct outside of that would be unlawful. So currently, in terms of the existing provisions in the Constitution and the Act, our mandate does not extend to the executive authorities. The bill that's currently in motion does not extend that mandate. So once the bill becomes an act, we will not suddenly acquire the mandate to conduct investigations into the executive authority space. And there's a logical reason for it. Our constitutional framework already establishes a Chapter 9 institution with that responsibility, that being the public protector. So both in terms of the Constitution, the PP Act, as well as the Executive Members Ethics Act, delegates that responsibility to the Public Protector's Office. So the Public Service Commission does not have the jurisdiction to intervene in that space. Maybe just two small comments, if you allow me to. Honourable Malinga, with regards to the CVPs, my DC has answered that comprehensively, but what I wanted to add was that the CVPs also forms a critical component of all of our investigations, our inspections, and our grievance investigations as well. So we look at those particular CVPs, issues of accountability, access to information. So when we're dealing with an inspection or an investigation or a grievance, we also look at the CVPs as being part of the framework for our investigation. So for example, an inspection at a hospital facility, CVP speaks to staff conduct, behavior, access to information, and all those issues. So in that way, CVPs is not only an issue that we promote in terms of engagement with staff, but we actively implement through the work that we do via our investigations. You also asked about the effectiveness of our grievance investigations, and DC's answered that. The only supplementation I will offer is that, in addition, what we also monitor is the rate of implementation of our recommendations by departments. And many instances you will see that some of the recommendations that we issue actually results in a change in policy, a change in procedure. And that is also what we keep track of, we monitor, and we keep a record of it and implement it. We've also seen that with grievance investigations, some of it is landed in the courts, for example. So in one particular matter that I can reference in the Western Cape, where the PSC made a finding regarding an irregular appointment. And after much to and fro with a specific department, the recommendation was eventually accepted, and an approach was made to the High Court, to the Labour Court, in fact, to overturn a particular irregular appointment. That shows you the impact and the effectiveness of the recommendations and the general work of the PSC, and all of that is captured and monitored by the Commission. Just one or two things on the financial aspects, the challenges. I think many of the honourable members have raised the issue of the financial challenges that the Commission will experience, and both my chairperson, the DG, and the CFO have lamented the financial position of the PSC, and I'm not going to add on to that. But some of the interventions that we are looking at to alleviate the financial pressures. In one of the last engagements, the DG indicated that one of the investigations we're currently busy with at CETA, one of the novel approaches is to actually get the department to fund the investigation. So in that way, with limited resources that we have, actually the department is now contributing to the costs of the work that is being done by the PSC. And as members will know, in terms of the bill, there's a provision in the bill which now introduces a new funding model, if I can use that phrase, whereby the PSC, similarly to what the AG does, will be able to actually charge a fee for some of the work that we do. And in that way, it will be a small way. It's not going to, eliminate the financial pressures, but in a small way, the bill is trying to address the fiscal challenges that are experienced by the Commission. Thank you, members, for raising the issue of security of commissioners. As you were asking the question, I'll leave you with an anecdotal story of today. I was on my way to today's proceedings, and my administrative officer said to me, "Commissioner, you can't walk." And I said, "Why?" And she said to me, "No, one of our clients or complainant who we ruled against a few weeks back had contacted the office on a few occasions today, inquiring about my whereabouts. And once knowing where I would be, wanted to know where, what time, etc. And she said to me, that tells me that something is not right. I didn't think anything about it, but it shows that the risk is there based on the work that we do. We do inquire into issues that are sensitive and that affects people's livelihoods. And the risk to commissioners and investigators cannot be underestimated. I'm not saying that this particular individual had any nefarious thoughts. He might just wanted to have wished me a happy Easter for Sunday. I'm not sure. But I won't be taking that chance. But I think it is a real issue. And as the DC's indicated, the Commission does take this matter seriously, and there are discussions with law enforcement agencies and other entities to make sure that, especially the chairperson who travels many late hours, that his safety is guaranteed at least. Thank you, Chairperson.
Thank you very much. Deputy Minister.
Yeah, just a few comments, Chair, but just also on a lighter note, just to indicate that PSC must not be a crybaby, because the issue of budget cuts are not unique to our department only. I mean, we are sitting here with bigger challenges of defense, of police, of teachers, of doctors, and everybody. And between ourselves as Team MPSA, we're trying very hard to make sure that the actual implementation of the Act or this bill that is being amended, there should be support by Treasury. So I'm just saying, it's not doom and gloom, but we are aware of the challenges that government is going through, and this is not unique to all of us. And we really want to see them becoming a fully fledged Chapter 10 institution. That's the commitment that our minister has made. On the comments or the issues that were raised by members, maybe one of the things that I should allay members' fears on, it's on the issue of performance bonuses. They are no longer there. They have been phased out. I may not be accurate with the year, but we can be able to come back to give you when actually were the bonuses, performance bonuses phased out. We only talk of pay progression, but the assessment has still been done. Every public servant has to be assessed, especially at that level, to see to it that they perform according to the targets that we have been able to set ourselves to. I think I agree with our acting DG on capacity of the state to deliver, because if you look at what Honorable Mamkize was talking on the issue of home affairs and other disservice that our community members are confronted with, it speaks to priority number 3 of capacity of the state to deliver. So between ourselves as DPSA and the Department of Planning, Monitoring and Evaluation, we do all those frontline monitoring to make sure that we do unannounced visits and all other things. And I think we'll always even call upon members to also do those oversights, but share with us where they see those glitches, so that even on our own we're able to do that, to help augment on the work you are doing, but also to go and give capacity and support on where the glitches are, including what you have picked up on connectivity, because it's also not unique to Msinga only. I mean, SASA, Home Affairs, and others have challenges. The post office has been having challenges. And I think the fact that government is prioritizing broadband rollout and how broadband infraco and SA Connect through DCDT are going to work on the issues of connectivity in communities. It will help mitigate on some of the issues that honorable members have picked up. I think what I want members to take cognizance of is that, yes, we all agree, we shouldn't have people at senior management level to act for a long time. We need stability at that level, because that will also speak on capacity of the state to deliver. But having people in acting position is not illegal, because there's a process to put. I mean, even now, our DG's contract came to an end, and then we had to allow Mr. Vukela to act. So the procedure is there to allow that acting position. So even when audit is done, when everything is done, it doesn't mean that if somebody is acting or we have many people acting, the finding of the Auditor General must be adverse or somehow. The fact that those people are acting there legally, whatever they'll be doing, they are afforded that opportunity by law, and they'll be able to deliver accordingly. However, we are not condoning the issues of people acting for a long time. And I think we'll be able to come back to you, because there's also a question that came to say, in this 7th administration, how many people are acting and so on, because many of the positions, especially at DG level, and I think you have also seen in DTIC, the minister is starting to beef up boards and other things. So we can be able to come back at some point. Acting DG Vukela can help, so that we just update you in writing just on where are the vacancies, how far are the processes of filling in those vacancies. But we must also start with ourselves as DPSA, because charity begins at home. I think as I close, especially on lifestyle audits, just to put members at ease. The way our department, in collaboration with other departments, from what and the law enforcement unit, from what the acting DG has said, the institutions, especially law enforcement institutions, with the companies that are empowered to help in lifestyle, just by a click of a button, they can pick up myself, my immediate family, my immediate friends, the cars I have through RTMC, the houses that I have through deeds office. Whoever has a car, or if Grand Kikana has a car, but Mshiga way, and that car is mine, and so on. So there are ways of picking up all those things. So the way SIU and all other law enforcement units and our department have worked along these things, it's now very easy to pick up and start to see a red flag on public servants. And even municipalities, once you go there and you declare yourself indigent, they can just pick up to say, how do you become indigent when you have a G-Wagon and a what, and another house in Balito, and so they start to see those things, and it's easy to clamp on some of those things. So I'm just saying, the systems are starting to talk to each other, and just give us time to be able to deal with some of these things. And the fact that members have supported the department to make sure that the amendments, the law amendments that we have brought to the attention of Parliament are being supported and underway. Surely the PSC will run fully. We will also strengthen ourselves, and then we'll be able to deal with some of those things. So we are there to really take you through on some of the things that you think you'll be wanting to get. Thank you very much, Chairperson.
Thank you, Deputy Minister, for those valuable inputs. The committee really does appreciate it. Members, we've gone well over time. I would like to encourage you that if there are any unanswered questions or remarks that you would still like to send, that you please send it to the committee secretary so that we can have further answers and get them in writing as well. I would like to thank all of the presenters and especially the members for sitting through a very long day. Our committee has become good at doing long days. We should maybe try and schedule it even longer. but thank you very much, and I hope everybody has a well-deserved break. And I will see all the members. We will see each other again in 2 or 3 weeks when we return to Parliament. Thank you very much for your attendance, everybody. Thank you. Meeting adjourned.